Good morning, everyone. Sorry I'm late. First of all, today I'd like to welcome all of you to the second hearing of the Joint Oversight Committee on Quality Affordable Medicines. And we are technically tasked, this Oversight Committee, to oversee the implementation of Republic Act 9502, or Universally Accessible Cheaper Quality Medicines Act. And this is the continuation of the first hearing that we had on February 8th. We made a commitment to do this quarterly, di ba, Congressman? Yes. And of course, before I move on, I'd like to recognize my co-chair, very active, dynamic Congressman. I was just with him in Dumangas last week. Sa amigo namon, si Congressman and Secretary was there also with Mayor Onal Goles. And so it's nice to see you again, to my co-chair, Congressman, of course, Congressman Biron, first Biron. And we're also very happy that Secretary Obial is here with us today to brief us on the implementation of our 9502, or the Accessible Cheaper Quality Medicines Act. We also will have with us from the Department of Trade and Industry, Miss Vivian Monsato is with us, and of the PITC. Are you with the PITC? Yes, the PITC. And she'll give clarifications to issues that were raised and not addressed by the DOH and the DTI during the last series, because we brought up the importation of medicines. And so, before we move on, with the permission, I'd like to recognize my co-chair and, of course, Congresswoman Tan is with us as well. Again, I forgot because she does not look like a congresswoman. So, Congresswoman Tan is with us as well. We'd like to recognize her, the chair of the Committee on Health in the lower House of Representatives. Will be joined hopefully later by Senator J.V. Ejercito, is the chair of the Committee on Health, and to replace, also for the record, to replace Senator Trillanes as a member of the minority of this august body. We appointed, or we elected rather in plenary our distinguished former chairperson of the Committee on Health, si Risa Ontiveros. So Senator Risa Ontiveros will be joining us in a bit. And so I'd like to recognize my co-chair and Congresswoman Tan for maybe brief statement, and we'll ask the Secretary just briefly mention the names of those who are here today for the record. So Congressman Biron, you're recognized, sir.
Thank you, Senator Subiri. Magandang umaga po sa inyong lahat. From the House contingent, I have the Chairman of the Committee on Health, Dr. Helen Tan, and shortly after the speech of our distinguished senator, we will have our own short speech as well. Thank you, Mr. Chairman.
Would you like to make an opening statement, ma'am? No, ma'am. So, thank you very much, ladies and gentlemen. Congressman Ferds, thank you so much. You know, you're the expert here. I'm not an expert on medicines and hospitals and doctors. This is a new field for me. When I entered as chair of the Committee on Trade and Commerce, I was only told at that time that we were also heading the Oversight Committee on Cheaper Medicines. So there's a lot to be learned this morning, especially with the Secretary being here to brief us. So without further ado, I don't want to give any more lengthy speeches. People don't want to hear politicians speak all morning. Marami yung kasamahan na ganun, na hindi yung nagsasalita i-resource persons. Kaya, umpisa na natin. I would like to ask the Committee Secretary to just briefly read the names of those that are here for the record today, and we can start with Secretary Obial.
Yes, good morning. Welcome to the Senate. From the government, led by the Department of Health, Secretary Paulina Obial, good morning, ma'am. And from the Food and Drug Administration, Deputy Director Maria Lourdes Santiago, good morning, ma'am. From the Department of Finance, we have Ms. Miriam Tesara, good morning. And from the DTI royal family, we have them from the Intellectual Property Office, Attorney Nelson Naluces. Good morning. From the Philippine International Trading Corporation, Mr. Vivian Monsato. Good morning, ma'am. From the Board of Investment, Mr. Manuel Cruz. Good morning, sir. From the PITC Pharma, we have Mr. Jose Capistrano Jr. and Mr. Jose Cortez. Good morning, sir. We also have from the private sector, from the Mercury Drug Corporation, we have Attorney Teresa Macaspac. Good morning, ma'am. From the Philippine Chamber Pharmaceutical Industry, we have Attorney Dave Escalona. Good morning, sir. From the Pharmaceutical Healthcare Association of the Philippines, we have Executive Director Chidoro Padilla. And from the civil society, we also have Laban Consumer President Attorney Rick B. Magiba. Good morning, sir. And from the Philippine Alliance of Patient Organization, Ms. Maria Lorenzo. Good morning, ma'am. We also have former Hepatitis C patient, Mr. Derek D. And one of our employees here in the Senate, a breast cancer patient, Ms. Reolyn Garces. Good morning po. Thank you, sir.
Thank you to our ComSec. We'd now like to recognize Secretary Obiang for her presentation. Thank you.
Thank you, Mr. Chair, and co-chairpersons of the committee, and good morning to everyone. So these are the updates on the presidential directives on promoting generics and lowering the prices of medicines. I presented to the Cabinet sometime in October last year the strategy by which the Department of Health and this administration will attain better health outcomes by lowering the prices of medicines and drugs in this country, which actually represents 70% of all health expenditures. Next slide. So drug prices globally is now an important global health issue. And there has been a high-level panel meeting in the United Nations where this was discussed. Fair Pricing Forum was recently conducted, I think last week, and this tries to increase access through better affordability of drugs. It focuses on the new high-priced medicines as well as vaccines that are currently unaffordable in most countries, regardless of income. But it also looks on old medicines whose prices have been so reduced that they no longer present any kind of incentive for manufacturers. Next slide. Even in other countries, the recent state of drug price increases promoted discussions. Like in the United States, the President Donald Trump actually, in fact, made statements that he vowed to bring down drug prices, in which the U.S. government is currently paying for drugs by allowing Medicare to directly negotiate with manufacturers and subject government contracts to public tenders. Australia as well, the government intends to change the prescribing software used by doctors with the default setting switch to active ingredient. Japan, on the other hand, has vowed to step up the pace and expand the scope of drug price reviews. One of the most aggressive measures it is taking is to rein on ballooning healthcare costs for a rapidly aging population. And a lot of measures on pharmacoeconomic measures, such as health technology assessment, to more rationally inform pricing decisions for innovative and potentially high-cost therapies. Next slide. What is a fair price for medicines? This has been a lot of debate in this particular field, and the World Health Organization actually defines it as a fair price is one that is affordable for the health systems and patients, and that at the same time provides sufficient market incentive for industry to invest in innovation and the production of medicines. Next. We're just showing to the members of the committee some of the newer treatments of cancers that is now available in the market, and this will be really unaffordable to many patients, and in fact will impact on the budget of the Department of Health, because currently we are covering breast cancer and cervical cancer. The 4 other cancers on the slide are not yet covered by our Medicines Access Program, as well as PhilHealth Z package are still not covering the other types of cancers. But hopefully, with the Philippine Health Agenda, we can actually provide better coverage and access, particularly for the poor Filipinos. Next slide. The proposed amendments, so we're proposing an amendment to the Cheaper Medicines Act to actually provide for lowering of drug prices in this country, generic only prescribing by healthcare professionals, and the creation of the Drug Price Regulatory Board. Because in the past, we were able to negotiate for prices, lowering of prices of certain molecules and certain drugs through the maximum drug retail price initiative. However, this particular initiative was not adopted in the previous administration. And so to actually determine what molecules, what drugs will be included in the MDRP, we propose the creation of an independent, outside of the Department of Health and outside of the regulatory functions of FDA, a drug price regulatory board which can advise the DOH on which drugs will be placed under MDRP. Next slide. So, generics only prescribing by healthcare professionals is one of the amendments the DOH is proposing in Republic Act 9502, including both medical, dental, veterinary practitioners, both public and private practitioners. Next slide. The creation of a drug price regulatory board, and this shall be part of the amendment if possible, and members will be 9, 1 from DOH, 1 from DTI, 5 from academe, and 2 from consumer groups. Next, we're actually, upon instructions of the Cabinet and the President, we have explored the possibility of a pool procurement scheme for all government procurement, particularly the DOH hospitals as well as local government hospitals, for commonly used drugs and products like the IV fluids available in our hospitals. So we have a technical working group that was created, and we are now in the process of signing a memorandum of agreement, particularly with UNDP, to actually look at how we can access these drugs in available markets worldwide at a more competitive price and a lower price. Then department order is being drafted on the technical requirements for government bidding, ensuring the quality of medicines in the public sector, to be targeted for signing within this month. The DOH is also preparing a proposal for additional medicines through the Medicina ng Bayan for submission to the Office of the President. This concept is that commonly used drugs will now be available in all health centers and hospitals and will be provided to the poor for free. Next slide. Industrial policy for generics. DOH and FDA participated in interagency discussions with DTI and the Board of Investments on the Pharma Zone concept last May 9, 2017, and DOH submitted priority list of medicines in need of more affordable quality generics, as well as provided input on the competitive strengths of local manufacturing industry. And there has been a number of international players, both from India and China, that are actually interested in relocating some of their manufacturing facilities in the country, in our pharma zones. Then we conducted, next slide, several patient forums. I think this is the third patient forum that we conducted last February 2017 to actually get the sentiments of our patients, the clients of the health sector in reducing out-of-pocket spending, particularly for medicines, and how we can work together as to implement the legacies of the Philippine Health Agenda. Next slide. And other input to the Republic Act 9502 is the creation of a drug price regulatory board. But in the meantime, we are creating a drug price advisory council. And this council will actually help the Department of Health in determining the list of drugs for inclusion in the maximum drug retail price list. Phase 2, because it was not implemented in the last administration, we hope to implement this MDRP Phase 2 in this administration. Next slide. So these are some of the list of medicines proposed by patient groups to be included as a possibility in our Medicines Access Program, as well as in the Linga Para sa Mahirap program implemented by the SWD but through the DOH hospitals, as well as for possible inclusion in MDRP. So these are very common illnesses of Filipinos, and actually very exorbitant drug prices. Next. So MDRP approval for a draft executive order I will be presenting to the cabinet in the next cabinet meeting, while we are awaiting the amendment to Republic Act 9502, whereby we propose a creation of a drug price regulatory board. And next slide. So MDRP Phase 2 timeline, we hope to have this in place, the advisory council in place by June, and the release of the list through an executive order by July of a number of drugs and medicines that will be included in the MDRP. Next slide. So thank you very much and good morning.
Thank you very much, Secretary. On your executive order, what is the timeline for the executive order? The establishment of your maximum retail pricing can be done in-house with the Department of Health, right? Under our 9502. Is that correct?
Yes, sir. Actually, it's provided by the law.
Yes.
But in the past, it was really through a presidential directive, through an executive order, that this was imposed on the industry.
What is the timeline for that? The executive.
Well, we hope to have it signed in July, sir, before the SONA.
This July.
Yes, sir.
This July. Do you have examples of? Could you divulge to us in today's hearing some samples of medicines that you feel are maximum pricing and what is being sold outside in the market? Maybe just to name a few.
Wala. Actually, I mentioned the commonly used drugs that were advocated to us by the patient group. But
Access medicines, right? Cancer medicine.
yeah, these are the high price and request of the patient groups to actually be available at a lower price. And we are also awaiting the formulation of the advisory board that can give us exactly which drugs we can put under MPRP, because we have to balance the drug pricing and its availability in the market, because there might be instances where we impose a drug price and pharmaceuticals might withdraw that product in the market because it's no longer viable to market it. So we really have to weigh the situation in this particular issue of maximum drug retail price.
The reason why I wanted to ask that is, last night I went to the wake of one of my staff in the Senate who's been with me since Congress. Well, his name's Buchoy Socrates Acuña, and he was diagnosed with lymphoma cancer in 2013. That was his first cycle, and I was no longer a politician at the time. I had resigned in 2011, and so we wanted to help him, so we helped him financially in 2013, and he went through 6 cycles of chemo. And each cycle cost $125,000. We were able to get it through NKTI. We did it first to Dr. Lorenzo of Makati Med, who happens to be my cousin. He's an oncologist there. We started with the Makati Med. We were able to get patient support, for marginalized patients. And then he got it back. He relapsed in 2016, and we moved into NKTI, and NKTI was able to give us cheaper package. But nevertheless, it cost hundreds of thousands per cycle, 100,000 per cycle. And I consider him as a middle class family. Nahirap na sila, middle class family, and one brother works for Congressman Ronnie Zamora, the other brother is a nurse, and yet they all chipped in paying the bills together with my family. And the expense was just unbearable. And he passed away this Saturday, and I went to see him last night, and to sad, I was in tears, and because he's been with me for the last 14 years. And it just goes to show talaga, we all hope and pray that none of us get sick here today, right? Simbaku sa Bisaya, na sana hindi mangyari sa atin yan. But when it does happen, it looks like in our country, there's nowhere to go but to the grave, you're just prolonging your life. Especially, you can prolong your life with the amount of money you have that can extend your life through treatments, or if you have no money, in many cases, the people that I speak to in Bukidnon or in Mindanao, when I go home, talagang pag nalaman nila na may CA sila or some sort of a terminal illness, they just because lack of funds, they just stay in their homes and wither away, unfortunately. Kawawa talaga ating mga kababayan. Kaya we have to do something a bit more drastic. We passed the Cheaper Medicines Act, and some of these, the owners are my friends, and when we have casual conversations in gatherings, sinasabihan ko talaga, we have to do something. Hindi naman pwedeng business as usual kasi it has helped open up generics, and totoo po yan, marami na po na mapipilian, hindi na po dati, katulad dati, branded ang ibibigay, ngayon generics na, pero hindi naman lahat ay nagge-generics, kasi alam ko sa St. Luke's pag nagche-check up ako, hindi generics na sinusulat particular brand. I probably still the option of the doctor. So I appreciate the amendments that you're pushing for, and I hope that to the pharmaceutical companies that are here, you have to make drastic changes on pricing if the global markets on other countries show that it's drastically cheaper in their areas. So it boggles the mind why we want to make so much money of our poor people in the Philippines. We have almost a 30% poverty incidence, and it will not change if we do not change our health system. And government cannot pay for it all. Hindi kaya talaga ng PhilHealth yung 1 million peso treatments for cancer. Hindi talaga kaya. Kaya kawawa naman ang ating mga kababayan na may sakit dito. At nagme-maintenance. Alam ko marami sa inyo, nagme-maintenance sa inyo, nagme-maintenance na. Lako nakita ng mercury drug sa akin, ha? I buy every month for my Forziga, my sa cholesterol and all that. I may be spending almost 10,000 a month on just these maintenance medicines. They're making a lot of money. But I'm not saying that to make sip-sip to them, because ang akin lang dyan is, kawawa naman ang Juan de la Cruz. Ang Juan de la Cruz, ang ating mga kababayan, hindi nila kaya yan. Yung mga constituents ni Congressman Biron sa Dumangas, yung aking constituents sa Bukidnon, sa Maramag, they can't afford it. So we have to do something. And that's actually my opening spiel. I wanted to hear the Secretary first and share my experiences with you and everyone's experiences here na napakamahal ng gamot sa ating bansa.
Yes, in fact, sir, we compared drug prices in our country and our neighbors, and it's still a fact that the drug prices in this country is one of the highest compared to our neighbors here in Southeast Asia.
So we're going to have to ask them why in a bit. But Congressman, would you like to comment?
Just, Mr. Chair, just a follow-up question on the issues that you raised on the observation of the Secretary that the Philippines has the highest price on medicine. So what could be the factors that make it higher?
Well, actually, our main problem is really the difficulty of the health sector, not just the DOH or the Philippines, but the health sector globally in general, because we cannot, there's no transparency in drug pricing. And the availability of information on how prices of drugs and medicines are actually put up. And I will just tell you our very recent experience. We wanted to buy antiretrovirals because of our increasing HIV/AIDS, and we provide 100% of antiretrovirals free to all diagnosed HIV positive cases in this country. So because we have a doubling of cases of nearly 2 years, the projection in the 2017 budget is actually double. So I told my staff we should procure more antiretrovirals. And what happened is that when we scanned the market, it's available here in the country at $60 per bottle, 100 tablets a bottle. When we look at the prices in India, it's $18 per bottle. So I told my staff, why don't we get from India? So, well, there were a lot of complications, and well, we were able to actually negotiate for a lower price in the local market. So I told my staff we should be able to also do that for the other drugs and medicines that the DOH is procuring in bulk. So I think that's also one of the issues that we have to work together as a country and as a community to ensure that we get fair pricing in this country.
Follow-up question lang po. She mentioned on the transparency of the manufacturers. Isn't it stated in the law that, especially on Section 19, letter F, that every manufacturer, importer, trader, distributor, wholesaler, and retailer of the drug and medicine, whether included in or excluded from the list of drugs and medicine that are subject to price regulation, shall furnish the Secretary of the DOH a list containing the prices, inventory of all drugs and medicines it manufactures, imports, trades, distributes, wholesales, or retails. So, ibig sabihin po ba nito ang ating mga companies as of the moment, hindi nila kino-comply itong provision na to?
Yes, ma'am, Congresswoman Tan. Our staff were saying that only those manufacturers and drug products that participate in bidding with the Department of Health participate in the electronic drug price monitoring system. So we get their prices. But the others who are not participating in the OH procurement process don't submit to the Department of Health.
But should submit. Pero ano po ang aksyon ng Department of Health to these manufacturing companies? Anong hakbang po ang ginawa?
Well, it's through FDA that will regulate these companies.
May we hear from the FDA? Kasi kaya ko po naitanong, na-mention din kanina ni Secretary on the transparency. On the side naman po ng manufacturer, baka din po ang isa sa rason bakit mamamahal ang gamot ay dahil po doon sa sinet natin na regulation, no? Ano ang inire-require mo sa mga companies that to comply that made the medicines prices higher. So ano po ang ginawa ninyo sa industry to compel them to report to you?
Your Honor, as far as the violation on the non-presentation of the financial statement, unfortunately, I do apologize. I do not have the information right now. What I only have would be their non-compliance to other violations like the technical requirements on good manufacturing practice. But I'll try to get the information at the office.
Thank you, Mr. Chair. Siguro po, may we require the FDA to submit this committee on the report. Especially, sir, last na lang po yung concern ko on the advertising po ng ating mga medicines. Ang mga companies po ba na nag-advertise, especially in television, radio, or prints, nire-require po ba natin silang mag-submit on the cost of the advertising? Kasi baka nakikita ko po, that's another factor that made the prices higher. So baka po pwede tayo mag-set ng price negotiation with them kung mas lower.
Your Honor, on the cost, I don't think it's part of the requirement. We only look into the technical details on the claims, but we will look into that, Your Honor. Thank you.
Mr. Chairman. I would like to direct this question to Secretary Obiel. Secretary, the Republic Act 9502 has been in place since 2009, and your predecessors had in fact failed to implement the law. That's a fact. So it's very clear in one of the provisions of 9502 that the Secretary of Health is empowered to recommend to the President of the Republic of the Philippines a list or a certain list of products for regulation, for price regulation. Well, it's very comforting to hear from you that finally, after 8 years, Malacanang has acknowledged that there should be a drug price regulatory board, because this is actually the heart of my bill. When I filed this in 2004, which eventually became a law in 2009, at the time, people in the Senate, our colleagues in the Senate and in the House, refused to believe that there is a need for a price regulation, because they would always advocate for open market, for a free competition. But after 8 years that the law has been in place, we all realize that competition is not enough. And therefore, we need regulation. So, ang tanong ko lang po una, Secretary, bakit po hindi ginawa ng former Secretaries of Health ang pag-recommend sa Presidente, knowing very well, now you may not be privy to this, but just for academic exercise, bakit po hindi ginawa ito ng mga predecessors niyo po?
Sir, Your Honor, I'm not privy to the information available at that particular time, or whether they have instructions from the President at that time. Because when I presented in October to the Cabinet and the President, I got specific instructions to make this happen in this administration. So we put in place the various initiatives of this administration to really bring down the prices of drugs. And one of them is the Drug Price Reference Index. We're now getting prices of all drugs that participate in DOH bidding, and we have that publicized, and we use that as a reference for all government procurement, even the local government procurement. And the next step is really going into pool procurement, and the other step is also implementing the maximum drug retail price, which we hope that because it's very difficult to also make that decision based on our own perception of which drugs are actually to be placed under MDRP. So we actually proposed to the creation of an advisory council, and we started writing people January po. Ngayon lang nag-respond some of the people we invited to be members of the advisory council, and therefore we hope to have this in place by this month or June, and then the MDRP to be signed by the President in July.
May I know, Madam Secretary, how much is the budget of DOH for drugs and medicines?
If it includes the vaccine, sir, it's about 16 billion. Yes, sir.
16 billion. If you look at the entire industry, the industry is at 200 billion. And DOH is a minuscule part of the entire industry. Therefore, government cannot do it alone. Therefore, we need regulation. Tinanong kanina ni Dr. Tan, our chairman of the Committee on Health in Congress, kung bakit masyadong mahal ang gamot sa Pilipinas. Your observation is valid that if a medicine would cost $60 in the Philippines, it could cost only $18 in India. If I may contribute something, coming from the industry myself many years ago, Philippines is a very unique market. This is the only market in the whole of Southeast Asia where retail is actually monopolized, almost a monopoly. I think most of the consumers here today listening to us, I'm a consumer myself, halos na tayo hindi nakakaalam that the reality is 30% of what we pay, whatever we buy from big chain drugstores here, is actually representing the discount, both discount given by companies when they sell their item to the drugstore. On top of that, the drugstore earns another 8 to 10%. In other words, if you pay 10 pesos for a pill, 3.8 pesos is the gross margin of the drugstore. If you go to Thailand, if you go to Singapore, walang ganong klaseng sistema. So, itong mga malalaking kumpanya dito sa atin are actually making life, harder for the ordinary Filipino. Kasi malaking discount binibigay nila sa mga malalaking drugstore. On the other hand, those small drugstores which are operating in the mountains of the Philippines don't get a single % discount. Samantala, itong mga maliliit na mga drugstores are the ones servicing the needs of the poor Filipinos in the mountains of Apayao, in the mountains of Kalinga, even in the mountains of my district. Ito po yung mga maliliit na Chairman, ang nagsasakripisyo bringing all these medicines, making them accessible sa ating mga kababayan. Because this big chain of drugstores operating in the Philippines will never go to the mountains of the Philippines because it is not profitable for them. So, napaka-lopsided, no? So that is why noon pa man, when we crafted the law, panahon pa ni Senator Zubiri, kasama kami ng 2004 13th Congress na pinaglaban namin ito, that the only way for prices to come down in the Philippines, in this country, is through mandatory price regulation. But mindful of the fact that, everybody should make money. The entire supply chain, should be economically viable. Hindi naman to the extent na mawala ng negosyo yung mga players natin, from the manufacturer down to the retail side. So it's very comforting that this administration realizes the fact that we need price regulation at this time. Yes.
Can I add, Your Honor, Mr.
Go ahead,
Chair?
Secretary.
In fact, in our drug price reference index monitoring, when we get the prices, there's no rhyme and rhythm to the prices of drugs in this country. Some of the same drugs that we procure here in Manila is actually cheaper in Mindanao. So we're wondering why that is so. We thought that the further you are from Manila, the more expensive the drug is. So there's no pattern in the drug pricing. And what we found out because of our drug price reference index is that if we use the median price of the drug across the country, many of our hospitals and health facilities are meeting, shall we say, bid failure. Because the drug companies in their area will not bid at that particular price. So we said, why is it that some of our hospitals can get it at a very low price and other hospitals will not be able to get that same price from that same manufacturer? But I think one of the observations we've also made is that it really has no pattern in terms of drug pricing. So the range of prices that we have monitored in this country ranges from, I think, up to 1,000% increase. It's so wide.
Well, Madam Secretary, yes. Well, yeah, it's difficult to understand why the same medicine is made available in Manila and that medicine is not available in Mindanao. Well, I think the Secretary should understand that in bidding, it is a scale business. So, with your proposal to have a pool procurement, the chances of not having a medicine in Mindanao would be very slim. Because big players will now realize that if there is a pool procurement happening in central DOH, then they will be more driven to participate because there is scale. And the ball game is totally different because they will earn a little for every unit of the product, but the volume that is generated in that bidding is huge. So I think it makes sense that while we are waiting for legislation to happen, the DOH should take that initiative of bringing pool procurement now in place. That's the only way to avoid failure of bid, especially in areas in Basilan. Because, there's peculiarity. Hindi mo pwedeng pilitin ang supplier niyo dito sa Maynila to bid in Basilan and Sulu because there are reasons or factors. The peace and order is one that discourages suppliers from Manila to go to Mindanao. But if you have a pool procurement where a supplier is now legally obliged to supply even hospitals in Basilan, wala silang choice because it's already in the terms of the bid. secretary is. So I think it makes sense that, the DOH under your administration, and I hope, Madam Secretary, you get confirmed so that, itong mga programa na naisip niyo ngayon, tuloy-tuloy itong mangyari sa administrasyon ni President Duterte. And while we are hoping that this drug pricing lottery board becomes a reality, the initiatives of the DOH should continue, particularly the pool procurement scheme.
Thank you, Chair. We'd like to also take note on the moves to approve the maximum drug retail price. So I asked earlier for examples, if you had a few already in mind, so that I can see, or the committee can see, what the disparities are. There's a saying, I remember in the mid-2000, sa isang scandal na nangyari sa gobyerno, they were saying, moderate your greed. So for the drug manufacturers, you have to moderate your greed because, in all honesty, ang kawawa dito ang ating mga kababayan. Secretary, I mentioned this in the first hearing. You were unfortunately not here in the first hearing. In the first hearing, my father, Governor Zubiri, when he first started the Provincial Health Indigency Program, we built 3 major hospitals in Bukidnon. Northern Bukidnon, Central Bukidnon, and Southern Bukidnon, the biggest being in Malaybalay City. Because he felt that health was the #1 problem at the time of the poorest of the poor. So he addressed it. As a matter of fact, it became a flagship project of the DOH. Pinupuntahan niya ng iba't ibang probinsya, Lanao del Sur, Lanao del Norte, all the provinces, even from Luzon, Governor of Pangasinan, the father of the governor now, had visited our province to do a lakbay-aral on the Provincial Indigency Health Program. And when he started, my dad was full of idealism and so full of gusto na gusto niya talaga tulungan ng ating mga kababayan through a cheaper healthcare service provided by the provincial government. Provincial government po nagbayad nito, hindi pa na-activate yung PhilHealth. Pero ng provincial government to almost 400 million a year or 500 million a year. So nangyari po, unang pagpupo niya para sa procurement of the drugs or bidding program, sa totoo lang po, on record to, linapitan siya, halos pare-pareho ang binigay na bids. Siguro ang kakulangan lang by hundreds or thousands of pesos. Tapos, isa-isa po nila linapitan yung tatay ko at sinabi, may mga rebates dyan, Gab. Sabi, ano ito sabihin sa rebates? Siyempre, wala naman sa industriya yung tatay ko. He doesn't know these things. Oh, he's a public servant. Sabi niya, may rebates po yan, may discount po yan, 30%. Pwede namin ibigay sa inyo, bahala na po kayo. Sabi ng tatay ko, hindi ba pwedeng yung rebates na yan? Pwede ba discount nyo na lang? Pwede ba ninyo i-discount yan? For example, kung paracetamol, kung 100, let's say 10 pesos yan, di 30%. So, pwede ba 7 pesos na lang ibenta nyo sa ospital? Alam mo, sagot nila sa tatay ko, hindi po namin magagawa yan, sir, kasi maraming makukulong. Because all around the region, that was the SOP. So there were mayors and governors who agreed to this price, signed off it. Because of corruption, what happened? Moderate your greed. Ika nga, hindi na mo moderate yung greed. Yan ang nangyari. And so, that was the first rude awakening of my father. Kaya nagkaroon siya ng good rapport with then former Secretary Pangandang, Obet. Pagdagana. Because sa inis niya, ang first shipments namin ng gamot galing India. He had to work it out until the generics law came out, and then generics na po. Bumagsak na po ang presyo. It was more affordable. But that's the reality of the situation. And I thought when we passed the Cheaper Medicines Act, when we passed the generics law, tapos na po, wala na pong problema. But apparently, we've been getting feedback because I had come home from the province also, ganun pa rin ang problema. Mahal po na mga gamot. And of course, ang nangyayari dito, ang kawawa ang taong bayan. So there, we're back to square one again. Tama po sinabi ni Congressman Biron and Congresswoman Tan, and I'm so happy that we're getting support from the House of Representatives. Something has to change. 9 years na to and nothing's happened. It's still the same. The pricing is still the same. I don't see a drastic change. Maybe later I will ask our cancer patient and survivors of health problems on their experience. And I'm sure it's the experience of every one of us was kamag-anak, kapatid, lola, nanay, tatay na nasa hospital po na yun. Kaya, I hope, Secretary, we can make a difference in this administration. Alam ko si Presidente, we're also close to the President at sabi niya talaga sa amin, every time po nagkakasama po kami sa dinner, sinasabi niya talaga, inis siya sa napakamahal na gamot. He says that, namamatay daw yung mga pasyente sa labas ng ospital dahil wala talaga silang may bibigay na gamot. At napakamahal, wala silang may bibiling gamot. So, maybe moving forward, because I'd like to also ask the drug agencies or the drug manufacturers what they've done in the last 9 years. But before that, maybe we could recognize the FDA because I believe they have a presentation. Who else has presentations here so we can give you time to do your PowerPoints? Does the IPO also have a presentation or just a statement, clarificatory statement?
Yes.
And kay Ma'am Vivian, do you have a presentation? Or?
Just a statement, sir.
Okay, so we'll now recognize first FDA. After that, we'll also recognize the other government agencies, what they've done in trying to solve this problem. And then we will now ask pointed direct questions to the drug manufacturers. What have they done? What have they done to moderate their greed? Kaibigan ko po yung mga may-ari ninyo, kaya alam ko po kung gaano kayaman po yung mga may-ari ninyo. And I mean, with all due respect, I love these guys, but I think it's time that we have to love our people more and give back to the people. Because many of these corporations are the top 20 corporations of the Philippines earning billions of pesos. And again, I came from awake last night, umiiyak sa akin yung nanay at tatay, dahil wala naman po silang may bayad sa maintenance, kaya they saw their child. A parent should never see their child pass away. They should never bury their child. To see their child live in front of them. And I hope this never happens to any one of us na mangyari po sa ating mga anak ito o mga kamag-anak. Dahil wala po tayong may bibiling gamot. Ibebenta mo na yung kaluluwa mo, wala ka pa may bibiling gamot. Dahil hindi po kaya. So, we'd like to recognize now the FDA. Thank you. Go ahead, Deputy Director General Lourdes Santiago.
Thank you very much, Your Honor. And good morning, everyone. Thank you for allowing us to present. Thank you. Well, thank you for allowing us to present before the respected Joint Oversight Committee. I am making this presentation in behalf of our Director General, Nela Sheree Dalang-Puno, who is in the presidential delegation in China, who is with the presidential delegation in China. Well, during the last hearing, my colleague attorney, Paulig, has actually reported the progress of implementation of RA 9502 insofar as FDA is concerned. So for today, I will just focus on the follow-up actions from the last meeting. Well, next slide, please. Well, with regards to the FDA 5-year strategic plan, the long-term strategies to be employed in the reform to be implemented by FDA shall be two distinct but congruent phases. Next slide, please. The first 3 years shall focus on the restructuring the agency's foundation, and this means that the agency shall strengthen its building blocks, its workforce, information, financing, governance, policies, processes, and services. And the years 4 and 5, which is 2020 to 2021, the agency shall move towards employing new strategies to accelerate growth, to engage the strategic partnership, and employ new age technology in the exercise of FDA's function. If you see, there are actually 6 imperatives under the restructuring of the agency's foundation, and this includes the establishment of an effective MIS operational systems, the reform of the organizational structure and human resource development, strengthening enforcement through the implementation of the laws, regulations, and policies. 4th would be to upgrade and improve facilities and infrastructure. 5th would be develop a sound and balanced regulatory policy framework by promoting smart regulation. And the 5th would be fostering public confidence through effective communication. And the second phase would be the further continuing of cooperation and collaboration with other government agencies so that we have one government approach to regulation. Second would be to build global presence and gain international recognition. Increasing digital enforcement activities. Establishment of more laboratories and strengthen its technical capacity. And the last one would be expanding the FDA Academy service portfolio. Next slide, please. Your Honor, I would like to highlight the 3 mega campaign of FDA to boost enforcement. The first one is the program we call it Deep Punch, where we actually train our regulatory enforcement units together with PNP, and they're actually given an appropriate equipment to conduct surveillance, intelligence, and case build-up activities in order to combat the distribution of substandards, peer use, falsely labeled, falsified, counterfeit, and adulterated products. The second one would be encouraging our MSMEs to apply for license to operate and comply with the regulation. And then the third would be the engaging public participation, and we will soon launch an FDA app, we call it BUSTED, so that the public can easily verify whether an establishment is licensed, and then they can report unlicensed establishments to the Food and Drug Administration. Next slide, please. So all these improvements and initiatives, including the use of our retained income, are actually described in the 5-year development plan, which was submitted by DG Puno last May 11, 2017 at the Department of Budget and Management. The strategic plan can be used as basis of the DBM in allocating bigger funds for the Food and Drug Administration, and it will also be used by FDA to adjust its fees in order to align its human and IT resources to the needs of the consuming public and the regulated industry. Next slide, please. With regards to Pharma Zone, next slide, please. I would like to report to this August body that as early as June 2014, there was already a memorandum of agreement with the Philippine Economic Zone Authority, where the FDA shall facilitate the applications of BOI applicants and the registered enterprises in accordance with the FDA Charter. On the other hand, next slide please, the BOI and PESA shall assist the applicants or the registered enterprises in the submission of and as well as follow up on the status of applications for permits, clearances, or issuance of certification by the Food and Drug Administration. Next slide, please. So in the recently held meeting with DTI, our Director General is actually committed to reduce the turnaround time on the processing of applications for license to operate and the certificate of product registration, including inspection. And specifically for inspection, there will be a 25% reduction in the processing time from 61 calendar days to 45 days. For the licensing of establishments, it is reduced from 30 days to 20 days. 30 daw, ma'am. And for the initial application, based on our FDA Citizens Charter, it's 254 days. For those who are really situated in that area, for the new chemical entity, there will only be a 190 days commitment in terms of processing their CPR. And for generic products, it would be 168 calendar days. So I hope this gets better as we expand our human resource complement. So next slide, please. With regards to the Philippine National Police MOA update on deputization, part of the agreement is to train next slide, please. Part of the agreement is actually the training of 500 police officers. And the deputization is divided into 3 phases, which includes the training of the officers, general surveillance and intelligence gathering. Third would be specific case build-up and enforcement. The Office of the Director General has already trained 200 police officers. Next slide, please. I think this is the last one. Next slide, please. On the GMP standards, as mandated, the Food and Drug Administration must ensure the safety, quality, purity, and efficacy of health products in order to protect and promote the right to health of the general public. Any drug manufacturer who wishes to supply drugs and medicines in the country must show proof of compliance to GMP, and this applies both to local and the foreign manufacturer. The standard that we follow, while it is called PICS guidelines, was actually derived from WHO, and it's also the one being used at the ASEAN, and there's really not much difference from the GMP standard that we used before the adoption of the PICS guidelines. We do recognize that there are too many requests for overseas audit if you compare to the number of if you compare to the number of inspectors. That's why since late last year, we have actually reviewed the AO 2013 number 22, and the DG is actually instructed to apply risk-based approach to inspection. It is currently being finalized, and the public consultation will soon follow. I think that ends my presentation.
Well, the Deputy Director General has a very impressive presentation on what FDA is doing at the moment. And I think, Mr. Chairman, before we tackle the issue of pricing, access is a primary and a vital concern. And this is where regulation comes in. The consumers will never have access to cheaper medicines unless FDA will be doing its job. All right. So the idea of having a pharma zone is a brilliant one. But if you look at reality, in the present regime, where registration, where approval of an initial application for registration takes years, and I think the Director General will agree with me, a minimum of 2 years, probably even more, or even 3 years. So if we are to invite a potential investor to locate in a pharma zone as provided by government, ang unang gawin niya ng potential investor is to have the plans of his pharmaceutical plant approved by FDA. So after the plan is approved, he proceeds with the construction of his factory. Probably it will take him a year and a half, no less than 18 months to build his factory. And then apply for an LTO, have it inspected, so probably it will take another 3 months. So, isang taon na yun, 1 month, 1 year and 8 months, plus 3 months is 1 year and 21 months. Pag binigyan siya ng LTO, the potential investor will have to undertake pilot production, right, Deputy Director General? So, the pilot production will take another year. So, halos 3 taon na po. Yeah. So, while doing the pilot production, simultaneously, they will undertake a real-time stability. Okay, so, while pinuproduce yun, may stability sila. Because under, I think, a new PICS requirement is that accelerated stability is not possible, but a real time of 1 year. Is that correct?
We allow at least 6 months of the study for the initial application.
All right. So 1 year pilot production, another 6 months of accelerated stability. So halos 4 na taon na yun. Okay, 4 years. So 4 years na walang ginagawa yung planta ng potential investor. If there is no special consideration with respect to registration, mag-aantay yung investor ng 2 taon. So 6 na taon na po yung investment na nakatingga dyan sa pharma zone. While doing that, may mga empleyado siya, may staff siya, may lahat. So, unless, Madam Director General, government does something about registration and separate the the applicants or the applications of these investors and put them in a special lane where you really have to facilitate. That's the only way to attract investors. Otherwise, these pharma zones will never be appreciated by any potential investor. While we're doing that, while we're still planning, the reality of the industry is right now, mas nahirapan ang ating mga consumers ng access because of the regulation where FDA requires foreign GMP inspection. And I think, Madam Secretary, I sent that letter to you to respond to Administrative Order 22 signed by the former Secretary Ona with respect to foreign GMP. Kasi ang reality ngayon is this. Nag-i-insist ang FDA to undertake foreign GMP inspection. But the thing is, we only have around 10 inspectors who are considered experts to undertake such an inspection in the FDA. So, in the last hearing we had called by Congressman Tan in her committee, the Director General admitted that to the committee that there are 600 applications pending for GMP inspection. So hindi ko alam kung totoo yun. Alright. If that was a guess or what, or an estimate. So, with 600 applications for foreign GMP inspection, and only 10 inspectors qualified to do that, it will take eternity for us to get these plants inspected under a PICS standards. Worse, our inspectorate agency is not even a member of PICS. Diba? So, noon sinasabi ko, how can we adopt a standard that we ourselves, the inspectorate agency, has not even been qualified to be part of it? So, paano natin i-impose ang PICS to any foreign company exporting their products into the country when we ourselves hindi ka tayo makapasa-pasa sa PICS standards? So that's one of the reasons why naging alarming ito, because mawawala yung mga gamot dito ng mga kumpanya na hindi pa ma-inspect, because strictly, if you follow the AO signed by Secretary Ona, those companies that are not able to qualify or have failed to qualify kasi hindi sila na-inspect, yung mga rehistro nila ngayon natitenga dyan sa FDA, Mr. Chairman, and FDA will not act on those registrations pending validation of the GMP compliance of these companies. So we will hear from the Director General if there is some development on the policy of insisting the implementation of this AO22, because reality dictates, Madam Director General, na hindi kaya talaga ng FDA. So if you insist on the implementation of AO22, maraming gamot, particularly generics, ang mawawala sa merkado.
Yes, sir.
Thank you very much, Your Honor, for raising those issues. We will inform the Director General about that. But as I mentioned earlier, since December, she actually instructed the FDA technical officers to review the existing AO. It is undergoing the finalization, and soon public consultation will follow. We have actually considered many of the suggestions coming from the stakeholders to allow risk-based approach and not to, with the limited resources we have, there are many adjustments that we have already made. I would just like to correct, while we acknowledge all the challenges that you have mentioned, I would just like to correct some figures, Your Honor. Like for example, with the number of applications for overseas audit, it actually went down to 388. That's the actual figure. And for the number of inspectors, it's not really that much, from 15 to 24. Hopefully, we have at the end of their training period, which is very soon, there will be 24 qualified overseas auditor.
Madam,
Again, I acknowledge
Yes,
the
sir.
challenges that you have raised, Your Honor.
well, thank you for the correction, Madam Director General. But even with 2088, with 24 inspectors, it would take you about 15 years to finish that. But let me just, the role of FDA is recommendatory with respect to AO22. Whatever recommendations the Director General has to make to the Secretary, it will be the Secretary of Health who will ultimately repeal, or amend, or whatever, at your pleasure. Looking at the reality right now, that access to medicines will be significantly affected if we don't do anything about this AO. And it's been, since hearing the Dr. Tan, our chairman, last year, we made this known already to the Director General. And it's been what? It's been 9 months. And she has yet to make that recommendation to the Secretary. Because at the end of the day, she cannot repeal the law, she cannot repeal the AO, she cannot even amend it. It's the call of the Secretary. So, sana man lang, since wala dito si DG ngayon, sana po, pag balik niya, mapagpipingan niyo po ito, so that recommendations can be done immediately, para maibigay po tayo sa Secretary of Health, para naman magawa niya ng remedyo itong AO na ito. Because right now, this AO22 is counterproductive. And it's not conforming to reality. Kasi insist ang foreign GMP inspection sa 400 applicants with only a handful inspectors. Mr. Chairman, I think it will, siguro matatapos ito sa second coming of Christ, na matatapos itong inspection na to. So while we're working towards, the conformity of FDA standards with the rest of the world, I think at the same time maging realistic po tayo.
Thank you, Co-Chair. I'd like to remind the Deputy Director General and the Food and Drug Administration, we're about to pass in the Senate and hopefully in the House of Representatives yung Ease of Doing Business Act, which is the expanded anti-red tape. Under the Ease of Doing Business Act, all business transactions by private individuals to government agencies, yung maximum, in this case if you're a pharmaceutical company which needs a bit of technical requirements, yung maximum allowable time frame for the issuance of the application is 30 working days. 30 working days po. Pag hindi po tayo nag-apply within 30 working days, may penalties po yun at criminal action. Dapat malaman po yun. Utos po ni Pangulo to. This Ease of Doing Business is a priority of the administration. We're on second reading already in the Senate, and Congressman Biron is already finished with the committee report. We're going to defend it as well in the House of Representatives. So we're looking at pagbalik po ng synergy, maybe that part of August we can make this into law. There's a provision there that if it's highly technical and the agency still needs to review the findings and documentation, they can be given a one-time only extension of 30 working days. So 60 working days yan. Hindi na sila maghihintay dapat ng isang taon. 6 na buwan. They have a recourse now, which is basically to file criminal cases to the government agencies kasi may automatic approval yan. Pag hindi po ninyo inactionan yan, but although you got the documentation, it's stamped that you received it with all the requirements there, there's a provision on the law that after 30 working days, if it is not acted upon by the agency, it is deemed automatically approved. So, dapat ma-forward po kayo. So now, second, the DBM is here, and I'm happy that the DBM is here. I know the FDA was just recently constituted, just a few years ago, with a new law. We now want to ask you on your organizational structure and staffing. Alam ko kulang po yung tao ninyo. Yung application, nag-apply pa kayo ng dagdag tao? Ano pa kasi, I'm also in the Committee on Finance. And I'm sure these two colleagues of mine from the House of Representatives are members of the Committee on Appropriations. Because kung kulang talaga yung tao ninyo, di dagdagan natin yung pondo ninyo para madagdagan ang tao ninyo. What seems to be the problem, Deputy Director?
Your Honor, since June of 2013, that was the first time we submitted our business plan. Unfortunately, it did not really satisfy the requirements of the Department of Budget and Management. What they did instead was to approve our first-year staffing pattern and the organizational structure. But with the recently revised business plan, there will be a massive expansion of the human resource, including the services that will be rendered by FDA. And that is actually part of the submission that was lodged to the Office of the Department of Budget and Management last May 11. The strategic plan that I described earlier was part of those documents.
Maybe you could ask the DBM. Are you familiar with this, Director? Ms. Clasara?
Thank you, Your Honor. We acknowledge the receipt of the advance copy of the revised 5-year developmental plan. We're just waiting for the original, which is supposed to be endorsed by the good secretary. In response to your concern on the human resource staffing of the FDA, in 2015 we created around 200 additional 200 positions for FDA, and at the moment total positions allowable to FDA is 843. Unfortunately, 293 remain unfilled.
So, ang sabi niyo po, nagbigay po kayo ng allotment ng items, pero hindi pa nila so hindi pa napifill up yun. So, yung kasalanan ay nasa ahensya.
You know, I don't know what delaying in the hiring of positions, but the additional positions were done in 2015 and we're now in 2017.
So, can you answer that, Deputy Director? Nabigyan pala kayo ng staffing items ng DBM?
Yes, Your Honor, that was actually what I have said earlier. I just failed to mention that in 2015, they actually approved about 800 positions under the new FDA, and that would mean additional 200 plus positions. Unfortunately, we're really having difficult time in terms of recruitment because there's not much applicant for the technical positions. That's actually the dilemma also. And the pharmacies, medical technologies, chemists, biologists, biochemists, so
mababa po yung entry-level offer.
that's one of the reasons, Your Honor. And also the available technical officers who wish to apply at the Food and Drug Administration.
We're not producing enough.
Oh, well, we have to fix that. We have to discuss it with the Director General because unfilled items yan eh. So, we have to work double time to fill that items. Like my good coach had said, if not, with 24 inspectors, siguro hintayin pa natin yung second coming ng ating Papa Jesus bago tayo maka-action dito sa mga request nila for Pharma zones. Diyos ko po, tagal-tagal. The problem is we have that law. I'd like to remind you, again, we are going to pass the expanded Anti-Red Tape Ease of Doing Business Act. So, please take note, ma'am. Kasi makakasuhan po kayo niyan. And for, we're all co-workers in government here, but we have to be practical. We also put a special provision on fire safety there kasi alam naman natin yung fire inspectors, minsan umabot na ng 6 na buwan, 1 taon, hindi po na nalalabas yung fire inspection permit, yung inspection permit. Lalo pa may dagdag pa na dapat bilhin nyo yung mga fire alarm nila at mga fire extinguisher. Kaya meron kami ni Congressman dyan na special section para sa kanila. Huwag naman sana na maglalagay din po kami ng special section sa FDA or other agencies, no? So I hope we can correct that, Deputy Director. Thank you.
Sir Co-Chair, it's good that the Deputy Director General has acknowledged that indeed there is shortage of qualified professionals needed to fill up this positions available at the FDA. Which brings me, Madam Secretary, to another discussion relative to, again, access, no, to medicines. Ang retail industry is expanding fast, no, and the expansion is brought about by these smaller drugstores like DGP, like Generica, and the rest, trying to reach out to the most remote places. And we're very thankful sa effort ng mga private companies na to. Through franchising system, they're able to reach out to even the most remote places, down to Sulu, Pasilan, Tawi-Tawi, and everywhere. And I think the most important challenge for this retail is hiring of pharmacists. Okay. Sa present setup ngayon, Mr. Chairman, the license to operate of any retail outlet is contingent to the license of the pharmacist. So, ang reality is, pag wala kang pharmacist, wala kang drugstore. At pag layasan ka ng pharmacist mo, kawawa naman yung may-ari ng drugstore. So that is the reality. So, if you want access, if you want to propagate, availability from the retail side, government should do something about regulation with respect to license to operate of retail outlets. So, sinasuggest po namin, and I brought this also to the attention of to the committee in Congress, and the chairman of the Committee on Health is aware of this. If you want access, if you want to improve access, dapat mas maraming drugstore, di ba? Kasi ito naman yung maliliit na drugstore, ang nagsiservice po ng ang pangangailangan ng mga taong bayan natin na hindi maabot ng mga malalaking drugstore. Because these big drugstores will never locate in the mountains of Quezon, in the mountains of Iloilo, or they will never do that because it's not profitable for them anyway. So, we have to do something about regulation of retail outlets natin. Ang suggestion ko po, Madam Secretary, Madam Director General, is instead of one pharmacist, pwede na siyang asampo. Alright? After all, supervisory malang ito yung role ng pharmacist eh. Right now, the FDA has implemented training and accreditation of pharmacy assistants. So they're no longer high school graduates, they're no longer the tindera that you know before. They're actually professionals and they're trained, they're accredited and trained by FDA. So we manage the risk of wrong dispensing and so on. After all, formulations na ngayon eh. You don't mix drugs anymore, you don't compound, So these are all in finished product. Finished form. Second, if you could look into this, that you can have 10 drugstores within a 5-kilometer radius na pwedeng mapalisensyahan yung mga drugstores na ito. And in a 1-week period, kung 10 po yun, 2 drugstore ang dutihan niya sa isang araw. Morning, afternoon, the following day, morning, afternoon, so a total of 10. So that way, hindi naman hawak sa liig ng pharmacist ang drugstore. Kasi naman, yun ang problema eh. Pag malayasan ka ng drugs ng pharmacist mo, automatically you have to close your Kasi pag inspectionin ka ng FDRO ng FDA, that's a violation. Operating without a pharmacist. So I think we have to respond to the changing times. If we mean seriously access to medicines, retail is the answer. So yun po sana ang matitingnan po ninyo, Madam Secretary, and discuss it with the FDA to modify the regulation with respect to retail licensing and providing the license to operate.
Yes, Your Honor, we're looking into that, aside from the fact that we're increasing the number of regulatory officers that are now. And we're looking at the availability of pharmacists because I think the enrollment and the production has really gone down in recent years. Thank you, Your Honor. We're also hiring pharmacists in the DOH, more pharmacists in the DOH to manage our increasing budget for drugs and medicines within the Department of Health. So we'll look into that, Your Honor. Thank you.
Thank you. Before we move on, I would like to recognize Senator Risa Guerreros, our distinguished member of the panel, the Oversight Committee. Ma'am?
Thank you, Mr. Chairman, and good morning as well to Chairman Foods and Rep. Helen, our counterpart in the House Committee on Health. And good morning to all of our resource persons. I'm very sorry, dear friends, to be so late. As I texted my chairman earlier, I came from an embassy of France, she-for-she event, which had long been scheduled. And I'll catch up, I promise, Mr. Chairman. I'm very glad that several points have already been discussed, and if there will be the opportunity later, I'll appreciate being able to ask some follow-up questions. Salamat po, and good morning to Sec. Pauline.
Thank you very much. I believe there's a question coming from our panel. Congresswoman Tan.
Yes, thank you, Mr. Chair. In relation to the question of our chair, Congressman Beron, I have read in one column that you wanted to revive the Butika ng Bayan, which I think will make it easy for you if you adopt the proposal of Cong Beron that we do have the interlocal health zone, a cluster of municipalities where you can actually send one pharmacist who can manage the Butika ng Bayan. So anong status nito, Sec? Yung project nyo po na Butika ng Bayan?
Yes, Madam Co-Chairperson, Your Honor, we are actually in the process of coming out with an administrative order to revive this, and instead of selling drugs, we will be providing drugs for free. So this is in the works. We have the administrative order drafted in April, and hopefully before the State of the Nation address of the President, this will be out, Your Honor.
Thank you very much, Sec. Natutuwa po ako marinig na you're going to provide free medicine. So, you're going to partner with LGU. How are you going to do it? Are you going to establish a new Butika ng Bayan managed by the DOH?
We will be partnering with the LGU and Madam Chair and Your Honor. We will be hiring pharmacists, yes, and stationed at the local government unit, and as you suggested, probably in the interlocal health zone, and having outlets at the front line, which is the health centers.
Thank you, Secretary. With regards to the availability of medicine, I'm aware that you do have a lot of programs providing free access of medicines to people from far-flung areas in the provinces. But the problem there is a gap on the, I think, delivery of your medicines down to the local government. Like, for example, free anti-hypertensive and diabetic medicines. Even if it's for free, wala naman pong makuhang gamot doon sa health center. So, I'm hoping na while you're thinking of reviving Butika ng Bayan, yung mga gaps po at this time na-address na kasi sayang po yung programa ninyo, maganda, but still yung meron access and availability. I think doable, pero yung best to do it lang.
Yes, thank you, Madam Chair. We are actually trying to fix our logistics management system. We have a grant from the European Union to be able to put that in place. There's a lot of activities going on right now in terms of having warehouses. We're building 36 warehouses at the provincial level. We're also contracting out to delivery points up to the rural health centers and the barangay health stations. Yes, Your Honor.
Thank you. Last na po. I'm happy to hear that you're going to build your warehouse kasi just to share to the body, I went to Lloyd Laboratories and you do have like how many? Thousands of paracetamol there, and I felt upset kasi basic need po yung paracetamol at the barangay level, and then it's been there for like over a year na hindi kinukuha. So I think naging warehouse nyo yung laboratory, you should have a warehouse in the provinces level. Thank you, Secretary, for addressing that problem.
Thank you. With the permission of the panel, and I will recognize Senator Antiveros first, because we have a patient here, may breast cancer patient po tayo. She happens to be working in the Senate. She's with the stenographers group. Gusto ko lang malaman, ma'am, before we move on with the other resource persons, ano naging experience niyo po, ma'am, as a breast cancer patient, Ma'am Yelin, sa inyong treatment, no? Nakakayanan ba ng inyong sweldo? Nahirapan ba kayo? And share it with this committee. That is why we're here, para mahanapan po natin ang solusyon ng problema ng ating mga pasyente sa ating bansa.
Okay, thank you po, Your Honor, for giving me this opportunity. Ako po ay breast cancer stage 2A. Nung October po ako napirahan. As a clerk po ako sa Committee C, under Jingle Alam. Ang experience ko po, yung paggamot ng chemotherapy ko, okay naman po. Kaya lang, yung nakagapay po kasi yung PhilHealth, PSWD, at saka PCSO. Matagal po akong pumipila dyan. Ang concern ko po, yung after chemo, yung mga yung post-med sa bahay, yun po yung mga napakamahal. Hanggang po ng ondansetron, yung also po, wala po yung mga generic every times a day po iniinom. Yung ondansetron, 400 po ang isa. Ganon. Tapos yung also po, kasi nagka-problema sa liver, 3 times a day, 100 po ang isa. Wala po siyang ibang generic hindi rin siya available sa mga yung generic pharmacy, hindi rin siya available sa oncology na gamot. Ang isa ko pa pong concern, yung mercury drive, minsan may dala akong reseta at saka mayroong PWD, hindi nila inonor minsan kasi iba daw po yung nakalagay na type of disability. Nakalagay kasi chronic illness, breast cancer, hindi po sila ka-avail minsan ng discount sa mercury drive. Ayan, yung po yung concern ko.
Magkano ang ginagastos sa araw-araw mong gamot? Para at least malaman po natin. Binanggit mo, 3 times a day, umiinom ka ng isang gamot na tag 100. Tapos meron ka pang iniinom na tag 400.
Yeah.
Magkano ang total cost mo araw-araw? Para at least malaman po.
More or less 1.5 a day for 4 days. Pero also po, parang naging maintenance ko na po itong 300 per day. Sa also po.
So yung 1.5 kasama na po yung 300 per day po yun.
Oo, kasama na po. At saka hindi po available dito sa mga NKTI kasi po meron po ngayong medical assistance na katuha pero sa office na kasi kang Senator Antiveros. Hindi po siya available sa NKTI yung mga drugs namin. One more concern, sa NKTI pala, pwede ka yung aking chemo drugs po dati available sa NKTI. Kaya lang hindi po ako doon hindi ako doon na kailangan na po kasi doon ka na-admit. And na-refer po kasi ako sa private hospital. Kaya sayang, hindi ko rin na-avail yung chemotherapy drugs na gamit sa inyong office.
So, ang kagandaan po nito, marami po kayo nalalapitan, katulad ng DSWD, mga opisina na senador, dahil empleyado po kayo. Pero in reality, sa 1.5 na ginagastos po ninyo araw-araw, sa sweldo po na natatanggap ninyo, ay kaya ba yun?
Mabigat po kasi 3 po yung pinapaaral ng estudyante. Kasi sa local government lang husband ko. Mabigat po talaga.
Hindi ko po ask Mr. Derek D. Maraming salamat po, Ms. Garces. At nakita naman po natin napakabigat. Buti siya po ay meron po mga access na ganito. Pero imagine sa ating mga kababayan secretary na walang access po sa mga offices of government. Mr. D, would you give us your experience po?
Ako naman sa hepatitis C. And siguro mga 3 or 4 years ago, during a routine blood test, I got diagnosed with hepatitis C. During that time, there was no cure. The only cure or treatment was interferon, ribavirin. And doing research on that drug, parang yung like that. And you go through it for mga 6 months, 1 year, and the thing about it, after 1 year, parang you're not cured. So, the treatment during that time for interval, like 6 months, 1 year, and 50%, ano. So, I decided not to go to, ano, I decided not to go to treatment. And, siguro 2 years ago, I stumbled upon a drug on phase 3 trial, no? It's in the stage, Gilead, no? And the FDA said if you approve it, they'll fast track it. And they fast track it, no? I got shocked when they came out with the price. It was for $1,000 per pill. $1,000 US. The treatment for sepsis, 3 months. So, the costing was mga $90,000 just for treatment, no? Walang mga blood test, walang ano. But, ayun, parang, I'm close na to the end part na, no? So, I pursued the drug. And other countries, they were selling it cheaply, like Great Britain, Canada, things like that. And I went to country through internet lang. And a lot of the countries parang they refuse me because I'm not a citizen of that country, things like that. And so I said, I said, sige, I'll consider trying na lang, you know. Basta may tax, they'll accept yun naman eh. So, but at the last minute, I decided to write an Singapore General Hospital. And the family said, okay, we can get it to you. We don't have it to you, but we can order the drugs to you. It was still expensive. It cost me 60,000 US. But compared to the one to the States, parang 100, you know. So, I decided to seek treatment in Singapore. And, yun, I completed treatment. And there's this thing, this thing called SVR, sustained viral load, no? Or response. 24 or 6 months after treatment, they test you again if the virus doesn't show up, you're basically, you're clear. You just have to take every liver, no? And I wanted to stop and just enjoy my life, my present something life, you know. There's so much embarrassment, you know, to come out here and talk about these things, you know, and I actually just wanted to keep a quiet life. You know, talking to Chairman Bayan, I said, you know, out of the blue, one friend called me up and from 30 years, and he came up to me and he said, oh, it's UFC. I said, don't you know where you can get this medication? And he said, yeah, in the States, but it's not able to get it for 1 million pesos or what. He said, bahala na, you know. I said, I think I know some Indian generic company that can give it to you at more than a 90% discount. And I got the information from him, and he got treated, it's okay. And I was okay, then another friend out of the blue called me up, you know. And he said he was dying. And I talked to him, he said, are you dying? He says, no, it's waiting for it to die, you know. Because hepatitis, it eats the liver, it becomes fibrosis, then cirrhosis, then you get a liver transplant, it becomes cancer. It's a hassle. You know, so I told him I can get the generic, you know, and he got it. It's okay now, you know. And right there, when these two people came up to me, they said, they didn't know anything about vaccine. I said, sige, I'll come out. I'll just, bahala na. My name will get through it, you know. It's such a nice name. And with my label just let's see, I'm fine with that. If I can say 2 or 3 lives, you know. So I'm okay, I'm here, I'm just trying to convince you to see what we can do for hepatitis patients. You know, there are 150 million people in the world. take it up, okay lang, you know. I have different ideas, you know. A lot of you guys were talking about budget, things like that, how to come up with paracetamol for your kids, you know, and I guess you guys are talking about how to get funds, no, to treat all these people, no? And I was thinking, about 2 months ago, about 3 weeks ago, 1 month ago, I came up upon a website, no? It's I don't know if any of you guys have heard of Lionel Messi. He's from Barcelona, he's one of the, I think he's one of the best players we have now in the in the world, no? And he came out with a press release that he's promoting in-job for medical tourism for hepatitis C. So it's a government-run, it's a government or state-run government initiative from India, and they're trying to attract foreigners to get patients from abroad to seek treatment, no? And I was thinking, Egypt was the first country to adopt this medical tourism exclusively for hepatitis C. And I don't know if you want to adopt that, pero I think it's very easy naman to get drug sources from India or APIs from China, just formulate it, put in capsules, and just sell it, no? Just when a government puts their stamp of approval on a drug and says, look, we're going to give this guys 5-star hotels. Sa Egypt kasi it's tour and cure. You tour the pyramids, and then you stay there for 5 days. You pay something like 2,000, 3,000. You get the cure, and they have a potential, you know, client base of 150 million. So I don't know why the Philippines, you know, maybe that can cover. That's just my idea, you know. So.
Thank you, Mr. D. No, we appreciate you sharing your experience,
Yeah.
especially for hepatitis C patients. Alam ko maraming hepatitis C patients
Yeah.
in the Philippines, and we thank you for that. But what is very clear, as what you said, if you go through normal sources, talagang $1,000 per pill, it will cost you $100,000, but yet you are able to find an alternative treatment program na mas mura ang gamot, na almost 90%. We appreciate that. The committee will probably get more inputs from you privately, no, on related date. But we'd like to recognize really quickly Secretary Ubial and then Senator Rosentiveros, if you don't mind. I think she wants to share. Do you
Yes,
have a
sir.
program for that, the Philippines, Madam Secretary?
Currently, we have access program for cancer, particularly breast cancer. We're allocated 50 million pesos for the budget, and these drugs are accessed for stage 3A and lower in 7 DOH hospitals across the country. So Jose Reyes East Avenue PGH, Rizal Medical Center, Southern Philippines, and Bicol Regional, and Amang Rodriguez. But we're also looking at the possibility of also having access for hepatitis C through the NKTI, National Kidney and Transplant Institute, very soon, sir. But I think we're also exploring a lot of access programs, particularly with Medicine Sans Frontier. I was talking to them recently, and there is some sort of negotiations that Medicine Sans Frontier can actually provide for the low-income countries. We're now middle income, but actually access to cheaper drugs across the world. So those are some of the initiatives that we are looking into, Your Honor.
Senator Risa?
Thank you, Mr. Chairman. Salamat kina Sir Derek at saka Ms. Realin sa testimonies nyo. Mr. Chairman, the testimonies point out the importance nung isang discussion point na napag-usapan natin nung unang hearing on where DOH was asked by the committee to provide the comparison of the price of cancer drugs in the Philippines with that of other countries. And I'm happy na in the earlier discussion today, nasabi nga na yung maximum drug retail price na expanded list will be ready by July 2017. So intayin po namin yon, and sana nga yung concerns sa mga cancer patients natin and even the people living with Hep C would be included there. I have a follow-up question po, Mr. Chairman. Dun po sa follow-up dun sa punto ni Chairwoman Helen kanina on the butika ng barangay. I also recall in the last hearing, the committee asked DOH for the costing of the implementation of the butika ng barangay program, which I understand is now the Medicina ng Bayan program. Opo. Could you give us even a few more details on the Medicina ng Bayan program, and how much it would cost to implement this effectively? Have you secured this amount already? And lastly po, habang nandito si Sec Pauline, last follow-up question for the DOH. Ano po yung status ng contraceptive prevalence rate ng mga reproductive health commodities? Could you furnish the committee a list of these RH commodities and the timeline for their expiration? Appreciate ko naman po, Mr. and Madam Chair, na the DOH has already sounded the warning to us and the public, pero ano po yung timeline sa expiration ng commodities na to, and what will be the next steps of the DOH to ensure that our family health programs will not be affected?
Yes, thank you, Your Honor, Mr. Chair and Madam Chair. The access Medicina ng Bayan is in the works, and currently we have around 2 billion budget, which is a double of the 2016 budget for the maintenance drugs that we are providing across the country, particularly for diabetes and hypertension, and some of the other commonly used drugs for high cholesterol, and also for COPD and other commonly used drugs. But we're thinking of another 1 billion pesos to be included to look at the commonly used drugs, particularly of the poorest Filipinos. And this will be through the Medicina ng Bayan. And right now, we don't have the funding for that, but we're looking at the Office of the President, where they provided 1 billion to the SWD for drugs and medicines for the poor, and the President was indicating that he has another 2 billion available through PAGCOR, the President Social Fund. Now, for the CPR, our last
Yes,
data...
Madam Secretary,
Yes.
I stand corrected. Masyadong RH kasi yung utak ko kanina. So,
Yes.
so of course, you know better than me, CPR, Certificate of Product Registration. So, ano na po
Contraceptive
yung...
prevalence rate, CPR. Wala ba?
Yung
Ay,
isa
hindi.
pong CPR pa rin po
Isa
kahit sa
pang
RH commodities,
Okay.
yung Certificate of Product Registration po.
Wala pang expired. Oo nga. No, we will send you the list of commodities that will have expiring CPR in the next 2 years. Most of the commodities are actually currently available, except for progestin-only pills that the CPR will be expiring this year, 2017. The other commodities, Madam, Your Honor, will be expiring 2018 and 2019. We will send it to your office. And I already sounded the alarm to the President about the TRO, and hopefully the Malacanang Legal Office will help us in pushing for an immediate resolution of the temporary restraining order to this effect. Thank you, Madam.
Thank you, Madam Secretary. Yun talaga yung dalangin ng lahat ng RH advocates na sana makapag-desisyon na yung Korte Suprema. At sana malift nila yung TRO. We all are probably aware of increasing number of shout-outs sa media, mostly from yung mga poor women, poor couples, and now also from women who say na kaya sana namin bilihin pa yung pills namin, whether for family planning or for ano ba ito, yung polycystic ovarian syndrome. Pero kahit sila na nasasabihan ng pharmacist sa botika na out of stock. So to know from the department itself that the progestin-only pills will run out this year, it's really like almost a panic button for us. So we'll work with you, Madam Secretary, to support you in altogether, hopefully in having a positive resolution from the Supreme Court. Harinawa. Mr. Chairman.
Thank you, Senator Hontiveros. I think my last question to Secretary Ubial. I was listening to Ms. Garces and Derek D. So obviously po, if you are suffering from cancer, it's a burden, emotionally, financially to the family and to the patients. Ngayon po, we have the IPO with us, and one of the provisions of the cheaper medicines law is having compulsory licensing. Yeah. So I am aware that on the part of FDA, you would allow Deputy Director General special importations on certain medicines that you qualify or categorize as compassionate drugs. You know, ondansetron is a very cheap drug. I think your ondansetron is a tablet. Is it in tablet, Ms. Garces? Tablet.
Yes, Your Honor, it's a tablet.
You know, it's a very cheap drug. I mean, if you buy it from India or from Thailand, it's very cheap. But if there is no local manufacturer, there is no scale. The reason why they don't manufacture because the volume may be too small. Perhaps the FDA can grant a special import license for the specific needs of cancer patients. Pwede naman ginagawa naman yan, di ba, Deputy Director General? You qualify those medicines as compassionate drugs. Drugs that are not manufactured locally or imported for reasons of less volume and whatever. The government can do something about it. And I think you can approach the Director General and the Secretary later, Ms. Garces. Yung Orsofoc, also the oxycolic acid, the volume may be so small, that's why multinational lang ang nag-import. I think you can source it also from other countries like India. So balik po ako dito, Secretary, sa compulsory licensing. If you learn from the lessons of Thailand, when the incidence of HIV was at its high, they resorted to compulsory licensing, and it's been there for many years, and I know that it's burdening the budget of the DOH, and no amount is always sufficient, is enough. So unless we resort to a legal strategy to bring down prices, I think we'll be able to meet the needs of our HIV. So have you looked into the compulsory licensing remedy?
Yes, sir. We've actually talked with IPO, and but instead of a compulsory license, they went for a voluntary licensing. So I think IPO can discuss that more fully.
Yes, can we hear from Attorney Laluces?
Yes, thank you, Mr. Chairman. Actually, that's part of the update that we are supposed to give today, but since it's taken up now, I would like to update the committee about the SCL petition, or the Special Compulsory Licensing Petition, which was filed by DOH with our office. As of the present, the status is that the parties, namely DOH and the concerned pharmaceutical company, are undergoing mediation. But in the meantime, they have come up with an intermediate solution to address the problem of DOH, which is the supply of the drug. So we cannot divulge the pending mediation proceedings, the details, but maybe in the next few days or probably weeks, they will come up with a solution which will be very favorable for both parties. And also in the meantime, Your Honors, the IPO field, this is the first time that petition was filed with our office. We are now finalizing the guidelines on special compulsory licensing petitions to be filed with our office. Thank you very much.
Mr. Chairman, just as a follow-up to the question of Chairman Biron, I recall also that in the first hearing, regarding compulsory licensing, IPO Philippines reported that you were processing applications for compulsory licenses, particularly for ritonavir and leponavir, which are drugs for HIV. Originally, I was going to ask only, inquire on the status and if you're allowed to divulge the nature of the applications. And I would have wanted to know only if this would impact access to ARVs. But could I add the question, I'm rather surprised, why are you shifting from compulsory to voluntary licensing when compulsory licensing is one of the mandates given to IPO Philippines under the Quality Affordable Medicines Law?
Your Honor, Mr. Chair, actually that is the subject of my update, the SCL that was filed by the OH. Now probably it's just a matter of looking at it because as I earlier stated, the parties are undergoing mediation. So if they finally settle, it might be named or maybe converted into a voluntary licensing because right now things are positive because they have sat down and they have tried and they're still trying to come up with a solution to the present situation, Your Honor.
Who are the parties who are sitting down, Deputy Director General?
The Department of Health and Abbott, which is the assignee of the patent owner.
Well, Mr. Chairman, just so that the committee understands completely what is going on and if ever we could share our opinion for the consideration of IPO Philippines and if ever make some suggestions, could IPO Philippines please just send just a description or explanation of what's going on to the committee regarding this shifting from compulsory to voluntary licensing and why this is not in violation of the Quality Affordable Medicines Law or why it is still compliant with the mandates of the law?
We will do that, Your Honor, but just a correction, again, a clarification. We are not shifting to a voluntary. It's because maybe it will look that way because the parties are negotiating at this moment, but the petition will be resolved in case they do not come up with a settlement. We will make the IPO field will issue a resolution on the petition.
Then please just include that in your communication to the committee.
Yes, we will.
Thank
Mr.
you.
Chair. Thank you.
With the permission of my colleagues, Secretary, you asked permission to leave early. You have a meeting. Maybe before you leave, I'd like to ask my colleagues if there's any one of them that would like to address the Secretary on other issues. You have a media forum. Okay. So maybe we'll just give you the result also of the statements of the drug manufacturers. A copy. We'll give you a copy of their
I
the
think,
discussions.
Mr. Chairman,
Thank you.
I think before the Secretary leaves, if with your indulgence, Madam Secretary, I would just like to, if you'd like to hear the comments of the Department of Trade and Industry with respect to the price regulation or the creation of a Drug Price Regulatory Board, can we hear
yes.
the from DTI?
PITC. See, I believe on Board of Investments, I think what's important is the... hindi ba
That's a
yung
Pharma
DTI?
zone. Anybody from DTI?
Well, we have none from the department, I believe, but we have from an attached agency, which is PITC. Di ba attached po kayo ng DTI?
Yes, sir, but we only handle po yung Pharma zone proposal.
As a pharma zone. How about Mr. Capistrano, sir?
We are Philippine Pharma Procurement Inc., formerly PITC Pharma, and we support the initiative of the Department of Health with regards to centralizing the pooled procurement of medicines, which we're already doing to a certain extent with our limited budget.
Mr. Chairman, just as a follow-up, and good morning to Mr. Capistrano.
Morning.
Pharma zones were also one of the important issues we discussed in the previous hearing, and I know you already made a presentation about it earlier. So could just wanted to follow up updates on the pharma zones, and if possible, ask you to submit a report on this initiative from DTI with recommendations for possible legislative support. So that's a request, Mr. Chairman.
Your Honor, I will pass on that request to the to PITC. Okay.
Thank you, Mr. Chairman. So, ma'am, just wanted to request that updates, report on the initiative from DTI with your recommended legislative support or requested legislative support from Congress.
Good morning, Your Honors. Our President, Dave Almarinis, the new President of PITC, and the new Chairman of the Pharma Zone, replacing Yusek Bawa, is now in Beijing together with President Duterte as part of his delegation. So his apology for not attending this committee meeting. On the updates of the Pharma Zone, there's an interagency technical working group composed by BOI, PEZA, BITR, FDA, and DOH. We had 2 meetings already, and of course we are finalizing the list of meds that needs to be manufactured, which will be recommended by DOH and FDA. And also, we got the commitment of DG Puno. She attended that meeting that they will streamline processes and even the timelines in registering approvals, product CPRs, and also for PEZA, we're still waiting for PEZA for their recommendation in terms of the economic zone area, because the government PEZA is already full, so they're looking for private economic zone area. So this still a work in progress. We're meeting again next week. So at this time, in fact, President Dave Almarinas wrote the Congressman Biron that the Pharma Zone will present its final proposal when President Almarinas comes back. Thank you.
Thank you, Mr. Chairman. I'd just like to reiterate my request, though PESA is already full and you are searching for private partners, maybe it's within the PPP model. Still, if there are legislative support you would seek from Congress, to please inform us so that we can study and partner with you on this effort.
Yes, Your Honor. Thank you.
Thank you, Ma'am Vivian. So we'll still await that presentation. Kulang pa yung presentation ng PITC. It's a recurring question. We've been asking the PITC in the last hearing to come up with their presentation as well for the DTI. I'll make Kulit Mon Lopez, who's I'm chairman of the Trade and Industry, he's the Secretary of Trade and Industry. I'll ask him to attend and make him present on behalf of the DTI what's other steps that we have to take. So, Secretary, I know you have to go. Maybe you can give us a final statement recapping your request for legislative amendments to 9502. Yes, Secretary.
Yes, sir, Mr. Chair and Your Honors. We're appealing to the Committee on Quality Medicines an amendment to 9502 on the generics-only prescription, and in terms of the medicines creation of the Drug Price Regulatory Board, instead of what we're now doing is an advisory council for the MDRP Phase 2. And we're also having other initiatives within the mandate of the Department of Health, the pooled procurement, as well as supporting the DTI call for pharma zones. We've talked to at least 2 or even three possible investors in a pharma zone from India, from China, and Korea. So there's a lot of interest, and I hope that in this administration we can really commit and see the light at the end of the tunnel, which is lower drug prices in the country. Thank you, Your Honor.
Thank you, Secretary. I believe there's just a few, just last questions from Ma'am Risa.
Actually, no more question, Mr. Chairman. Just a manifestation of support for DOH's proposed legislation amending RA 9502, specifically generics prescribing in both public and private sector, and creation of the Drug Price Regulatory Board. Especially, Mr. Chairman, because these provisions were part of the original draft of the Quality Affordable Medicines Law, but which were later removed in the final version. So it's good for us in our exercise of oversight function to look at how to strengthen the law. And so I commit to telling my chairman in the Senate Committee on Health, J.V. Ejercito, about this, and to seek his and the committee's support for this. Thank you, Mr. Chairman.
Thank you. So you're excused, Secretary, but could you leave somebody here that at least could answer a few questions if it crops up? Thank you, Secretary. Thank you. So now, with the permission of my colleagues, do we go to the drug manufacturers? And now you've heard in the two hearings the statements of many of the agencies and individuals and patients. We'd like to hear from your side in trying to convince us not to pass the Drug Price Regulatory Board, because it looks like with the new administration now that's pushing for cheaper medicines, this is the route that this Oversight Committee will recommend to our colleagues. Who would like to start the ball rolling for the drug manufacturers? Okay, Executive Director Ted Padilla, you are now recognized.
Good morning, Mr. Chairman, Senator Subiri, Congressman Biron, Congressman Tan, Senator Ontiveros, and distinguished colleagues from government and from my colleagues from the private sector. Thank you for giving us this opportunity to present this morning. If it's by permission of the chair, we would like to read a statement. We don't have a presentation, and I can assure you it will not be a lengthy diatribe, but it will certainly answer many of your questions. The Pharmaceutical and Healthcare Association of the Philippines is composed of national and research-based medicines and vaccine providers in the country. We remain committed to contributing in the development of comprehensive, sustainable solutions to strengthen the country's healthcare system. PHAP and our members have been partnering with government, the healthcare community, and patient organizations in the implementation of programs to fight our common enemy, diseases, and also to overcome barriers to healthcare. PHAP recognizes poverty as a social barrier to health. Most of the medicines continue to be inaccessible to many Filipinos due to poverty and the need for social health insurance. Thus, no matter how low medicines are priced, they will still be out of reach for many Filipino patients, as evidenced by credible policy studies on the impact of price regulations on medicine access in the country. This is largely due to the fact that access to healthcare largely depends on the patient's ability to pay, as the individual patient pays the treatment cost out of pocket. In the Philippines, patients oftentimes pay 56% of their healthcare costs. This observation has been reaffirmed by an ongoing study being conducted at the moment by the former Dean of UP School of Economics, Professor Ramon Clarete. It examines the impact of government policies to improve medicine access through the Cheaper Medicines Act, the Generics Act, and Botika ng Barangay, among other efforts. At the end of the study, it aims to provide basis on recommendations to improve medicine access in the Philippines. The study will be completed within the year. Recognizing health barriers, our members undertake initiatives that would expand access to healthcare and carry out our business responsibly. In support of government efforts to improve medicine access, our members operating globally build a strong case to make each and every innovative medicine readily available locally to avoid delay in treatment. Our members also devise patient access and support programs for priority diseases in partnership with government, patient groups, and healthcare providers to help ensure that Filipino patients benefit from these medicines. A price control policy cripples the industry's capacity to support these health and medicines access programs intended to benefit Filipino patients, as well as limits our ability to reinvest into the research of medicines. Knowing the financial limitations of the poor, we laud government trusts to provide free basic medicines in government district hospitals, barangay health centers, and local health units. We also support efforts to expand PhilHealth coverage for vulnerable populations, to align various sources of healthcare funding, and therefore reduce out-of-pocket spending. We commend efforts of the Department of Health and the Food and Drug Administration to promote the use of generic drugs, resulting in robust market competition and wide availability of alternatives for Filipinos. Generics now pervade disease categories and have significantly broadened choices for Filipino patients, particularly so that 90% of our medicines are off-patent. The latest industry data reflect that indeed generic medicines now dominate and outgrow the market in volume. A key development on this regard in terms of healthcare infrastructure is the emergence of generics-only retail chains and outlets. We are ready and always available to dialogue with the government to help establish key strategies that take into account economic forces and the patient's ability to pay. These could be discussions on successful models involving volume, central purchasing and procurement, and long-term predictability of demand to improve medicine access. We note that the Universally Accessible, Quality, and Cheaper Medicines Act recognizes mandatory price cuts only as a reserve instrument and a temporary measure in the absence of effective competition. On the other hand, the law gives primary importance to facilitating the development of a free and competitive environment that would allow market forces to provide choices and alternatives for patients, as well as shape the development of the pharmaceutical industry. While price regulations did not achieve intended health outcomes, mandated price reductions were proven to have serious implications to industry growth, slowing down sales growth rates in the Philippines ethical market from a 2-year compounded annual growth rate of 11.5% to 4.3% after the price cuts in 2009, thereby reducing government revenues in the form of tax collections. What we propose instead of price regulation is we welcome current government efforts to advance pharmaceutical manufacturing in the Philippines to encourage investments on health and research and development. PHAP stands ready to partner with the government in finding solutions to help close the gap in access to medicines. We continue to dialogue and explore public-private partnerships such as licensing agreements, technology transfer, and capacity building, which are in place in other developing countries. We emphasize that medicines alone cannot solve the underlying problems of health, of poverty, inadequate public health services, or the lack of healthcare personnel or infrastructure common to many countries. The World Health Organization considers medicines and health technologies as only one of the 6 building blocks of a health system. A universal healthcare approach, which I'm happy to say Congressman Tan has been pushing, offers a more sustainable solution to improve access to healthcare, particularly for the poor. Thank you very much.
We'd like to recognize Attorney Davis Calona. What we'll do probably is get your statements and then we'll ask questions right after them.
Yeah.
Attorney Dave.
Good morning, Your Honors. Thank you again for inviting us here. The Philippine Chamber of Pharmaceutical Industry is the association that represents the local generic players. And we'd just like to reiterate our position that we stated during the last hearing. And that is, while we do acknowledge that there is still a lot of room for improvement for prices of medicines in the Philippines, we would like to point out that the generic players have provided a strong and robust competition against the innovator and high-price branded products. In fact, if you would recall during the last hearing, and I'm willing to share it again, we did enumerate a number of products, essential medicines, where there are a lot of generic players already. And you see a price range from a very low, let's say, of 3 pesos to a high of about 30, 40 pesos. So we are here. In looking at, and we'd like to request DOH, I'd like to ask them if, seek clarification, when they talk about comparative prices with other countries, do they limit this to comparing a branded product on how the price of that branded product is sold to in other countries? At which point, if it is higher there, then it is lower there, then we say that prices in the Philippines are high. Because the way we think it should be done is you look at the Philippine market, you look at the molecule, not the brand, and you look at all the players in that particular molecule. And if the generic players are there, if they provide much cheaper medicines, then we believe that there's not much need for government intervention as far as prices are concerned, and let competition dictate those prices. We do acknowledge, however, that the generic players are not in all molecules segments. And this is where, as PCPI, as the generic players, we'd be open to and interested in finding out what these molecules are which the DOH would like to put under MDRP. Because consistent with our position, indeed, if there's no generic competition against a particular molecule, then maybe, for the sake of the Filipino people, government intervention is needed. Thank you.
Thank you. We'd like to also now acknowledge Attorney Makaspak, please, of Mercury Drug.
Yes, thank you, Your Honors. If I may read the statement of Mercury Drug, with your permission. Mercury Drug, like the government, and we believe everyone in this room, we share the same objective to provide every Filipino access to effective, quality, and at the same time, affordable medicine. The enactment of the Cheaper Medicine Law in 2008 has significantly changed the pharmaceutical industry. Due to strong competition between the drug innovators and the generic sectors, the disparity in the pricing of medicines has been remarkably reduced, thus benefiting the end users. And even before the passing of this law, Mercury Drug has been constantly faithful to its commitment to provide affordable and quality medicines to the public, whenever and wherever, regardless of the latter's economic status. Through the years, Mercury Drug has given the Filipino people access to quality yet affordable medicines. In fact, we have been doing our best to maintain a uniform price nationwide in our branches as far north as Apari and as far south as Cotabato, regardless of the varying administrative, operational, logistical cost in bringing in the medicines to these areas. However, accessibility to cheap medicines should not be our lone and main advocacy. Let us not veer away from promoting safe, effective, and quality medicines, as these products are not mere commodities, but instead are life-saving. The prime concern of retailers must be the preservation of effective medicines of high standard of quality, because wrong handling and storage can affect the potency of these medicines, which can lead to more serious illnesses and even death in extreme cases. For Mercury Drug, preserving this standard of quality means equipping every store with biological refrigerators, good storage facilities, good ventilation, and of course, knowledgeable personnel. In line with accessibility and availability, we have to maintain stocks of wide range, including regulated and dangerous drugs, whether they are fast and slow-moving, to be able to meet the needs of our customers at any time. We continuously support our government in their initiatives for regulatory compliance standards. While we undertake all these measures and incur necessary costs in keeping the quality of medicines at their optimum level, Mercury Drug puts forth its earnest efforts to make affordable quality medicines accessible to the public despite the mandatory government-imposed discounts. Again, while we share the same advocacy of accessibility of affordable medicines, we would like to have an in-depth review and understanding of the proposed legislative changes, which the government will further undertake to lower the prices of medicines, in order for us to come up with a definite position on the matter. Nevertheless, it is our prayer that the government, through its legislative arm, take into serious consideration all the operational factors that come into play in the pharmaceutical retail industry, so as not to sacrifice or compromise the quality of medicines and the health of the public, which our Constitution so dearly protects. In keeping with its mandate and obligation to the public, Mercury Drug still continue to support the government in bringing quality and affordable medicines to Filipinos. Thank you, Your Honor.
Thank you. Please submit the copies of the statements that you've read, Mr. Padilla and Attorney Teresa. Okay, thank you. Mr. Cortez, would you like to make a statement?
We are Philippine Pharma Procurement Incorporated, as mentioned by our boss. We're currently
Hindi
doing
pala kayo
full
kasali
procurement.
sa private sector, ano?
Before po, nandun ako. Ngayon, sa government na po. Okay, thank you po.
Thank you. A quick statement before I recognize Congressman Piron, my co-chair. While listening to your statements, it seems that you really you believe that, number one, not necessary to have a drug price regulatory board. Number two, let free market forces dictate through competition the pricing. However, as mentioned earlier by Congressman Biron, it's been 9 years, no? 9 na taon na po ang implementation ng Cheaper Medicines Act. And although there were reduction of prices because of the generics that were introduced to the market thanks to the local players, pero ganun pa rin yung impact felt by the local communities at ang masa ay hindi po nararamdaman. That's why we're doing this. We're doing our oversight functions to really review the legislative agenda of each Congress to see if we can enhance the law even further. So it's still, I'm not convinced, guys. I'm not convinced why we should not put a drug price regulatory board. Listening to our patients that are here today, it seems that there really is access to cheaper medicines out there. If we go in the internet and do research, if you do your own personal research, talaga makakahanap ka ng mas murang gamot. Which boggles the mind in a country like ours na 30% po ang ating poverty index, napakakawawa po ng ating mga kababayan. Talagang you lay there and you die there. Yung kanta ni Mona Lisa. That's what's happening, unfortunately. So we have to make drastic changes. And it seems that market forces, doing free market forces has not worked. I think we passed several legislation wherein we allow free market forces to take effect. For example, yung ating deregulation of the oil industry. So totoo lang, hindi naman bumaba yung presyo ng gasolina. Pare-pareho naman ang presyo ng gasolina. Magkaiba lang, 1 centavo, 2 centavos. We thought that opening up the market of gas stations, white stations, and all that will bring down drastically the pricing of fuel. That was the idea then, the recurring idea then. Apparently, it has not. Even the deregulation of the power industry, it's supposed to bring down cost of power. Parang hindi naman yata bumaba yung presyo ng kuryente dito sa ating bansa. So same is true with pharmaceuticals and medicines. It's my 2 cents worth, no? Being a practical, just trying to be a practical public servant, na hindi talaga gumana itong free market-driven, free market-driven legislation in terms of cheaper medicines. So we'll have to revisit and rethink what we in government, especially the legislators, can do to help Ms. Garces, Mr. D, and many of the patients that are suffering daily. No? So, Congressman,
Mr. Chair, maybe before I respond to the statements made by Mr. Padilla, we could allow Attorney De Magiba to, consumer president ng Laban Consumer Incorporated, to make his statement.
Thank you, Mr. Chairman. We shall be glad to support in the public hearing the bill on the creation of a drug price regulatory board. And also, in that connection, Mr. Chairman, we should bring back into Republic Act 9502 what was repealed by RA 10667, or the Competition Act. That act repealed sections 24 and 25, the illegal price manipulation and the penalties. So if we will create a drug price regulatory board, I think these two sections should be brought back, because that will be the, that will be the baton of the board for illegal price manipulation. In fact, in your earlier presentation, when you mentioned about that 50 peso price difference between one store and another store, that's a very clear case of profiteering. Under 9502, the implementing agency should have issued a show cause order to the retail store to explain why they should not be charged with profiteering. But at the moment, 9502, the penal provision and the violation were repealed by the Competition Act. In addition to that, we should adopt the formula in the Competition Act where the penalty for violation of illegal price manipulation shall be ×3, really to make the penalty very, very punitive in relation to the powers of the Drug Price Regulatory Board. Well, in hindsight, when I was still in DTI and this bill was being deliberated, internally in DTI, we supported the creation of a board. But instead of price control, we were trying to introduce something similar to the Price Act, which is a concept of suggested reasonable retail price. That's where you even out the interests of business as well as consumer. I don't know what languages the bill will be in its form, but at that time we shall be glad to really participate. I mean, we can strike in between in order that it will not be technically price control, but something that will give the industry a reasonable rate of return for their investment, but the consumer is assured a wider choices, you know. On the generics drug, I think it's about time that doctors should really, this should be something already at the back of their mind, that even if they assign their assistant to do the prescription, the assistant should already know how to write the generic component. And it's okay if they want to put the brand name, but the generic should be the primary word. The generic, ay yung brand, yun lang yung parenthesis. Minsan, Mr. Chairman, baliktad. Yung brand ang una, yung generic naka-parenthesis. I also take my compliance medicine, so I had experiences on that regard. Okay. So yun lang po. Maraming salamat, and we shall be glad to continue participating in the invitation of the committee. Thank you po.
Recognize Ma'am Gurley of the patient organizations.
Thank you, Chair, Co-Chair. On the part of PAPO, our patients really come from the poorest of the poor. So, to our mind, even if the prices are reduced, because the patients really don't have money to buy the medicines, so they will not really benefit from lowering of the prices. But instead, we would really, and we laud the DOH because of the Medicina ng Bayan program, that maybe we should really put more money for the DOH to buy the free medicines really for our patients. So that's one, that we can, that DOH really, that the government really spends more money in DOH for the medicines. And second, hopefully the DOH will also focus on primary health care so that it will not anymore escalate into chronic illness. So if we focus on primary health care, put medicines that will, in the onset, already cure the patient on the primary level, then it will not graduate to chronic illness. And third, for the middle class patients, PAPO is hoping that we will impose a maximum copay for non-indigents, because that is also one way for the patients to be able to have that money to access medicines. Yun lang po.
Thank you, Ma'am Gurley.
Just one more.
Yes.
I just want the chair and the co-chairs to be aware that, and I already asked DOH Secretary Ubiar regarding this. I just want you to be aware that the medicine mercaptoprine was unavailable to our patients for 7 months. So that really affected the maintenance. Our patients who are already on the maintenance stage, because this medicine was unavailable for 7 months, they've relapsed. So we want you to know that there's really a problem regarding logistics, procurement, delivery. So maybe before we really think about lowering, let's fix the system of procurement and delivery of medicines. Thank you.
I think, Ma'am Gurley, that's where FDA and DOH could come in. They can selectively import medicines for cancer patients and other chronic illnesses under the compassionate drug special licensing. Maybe we can hear from the Deputy Director General for her assurances.
Thank you, Your Honor. Well, the compassionate special permit is actually available for patients whose medication is not actually available in the country, but we can source it from overseas. So it's a facility that is always available to all patients. Thank you.
Yes, Ma'am Gurley.
The patients really would like to know why mercaptoprine was unavailable to us for 7 months.
Could you identify yourself, ma'am?
Yeah,
Doctora?
Good afternoon na po. I'm Dr. Irene Fariñas po from the Pharmaceutical Division of the Department of Health. Actually po, the problem encountered during the delivery of mercaptopurine, it was the delay in the acquisition of the certificate of product registration, and also since there was a delay in the CPR issuance, ergo there was also a delay in the delivery. But for the information of Ma'am Lorenzo and Ma'am Lorenzo of Papo, the medicines have already been delivered to the hospitals last week, first week of May.
Thank you, Doc. So, Deputy Director, the delay was in your office. It costs lives when you delay these medicines, huh? It costs
Your Honor,
lives.
I apologize. It's only now that we have learned about this instance. I have to look into this. Why was the delay? Because for all national public health programs, it was treated as a priority for FDA. Always, it's a must that we will facilitate medications or medicines that are considered under the public health program of the Department of Health.
Please look into this,
yes,
Director.
yes, Your Honor.
because Really,
yes,
this
Your
is,
Honor, yes.
it's unacceptable. Unacceptable. Yung government hospitals na wala ng gamot dahil sa certification ng isa pang government agency. As you can, and I will recognize Ma'am Gurley then
Okay.
to respond. No,
yes.
they went back to the mission. They
No,
are in the mission?
well, yes.
I'm sorry, they relapsed rather. Sorry,
yes,
they relapsed.
because they're already supposed to be on maintenance medicines, but because there was no mercap to complete the protocol, they relapsed. So now we have to go back to step 1. So, we've been helping these patients, and it really breaks our heart that, they'll have to go back again to step 1, step 2, and all that. So, there's all.
Yes.
Mr. Chair,
Okay.
as a follow-up to that, is there a hotline that patients or patients' organizations can immediately alert FDA of such a situation and there be a quick response mechanism? Kasi hindi talaga biro yung halos gumaling ka na and then babalik ka sa mapanganib yung yung sakit mo. Is there such a mechanism, ma'am?
Yes, Your Honor, there's actually we have in the website the e-report facility and also the FDA hotline, which unfortunately we're having difficulty right now accessing. Yeah.
Yes, I'm just wondering because Dr. Fariñas mentioned earlier that the reason for the gap that took place was because the importer, I believe, was waiting for the release or the approval of the certificate of product registration. So, is that the only registered product in the market today?
Yes, sir, according to PPPI.
All right. So if it is, I'm just wondering kung saan kayo bumibili ng mercaptopurine ninyo before, Ma'am Girlie? Because sabi nila, they have only one importer of that product for leukemia. So, sino ngayon ang binibilhan ninyo? Are you buying it from the black market? Are you procuring it directly from India?
No, honestly, sir, because it was unavailable everywhere. It was unavailable everywhere. We could not buy anywhere. We could not.
Okay, so right from the start, may problema pa talaga kayo sa supply.
No, before the 7 months, prior to the 7, it was available.
But who was supplying it? Because according to DOH,
We would buy from Globo or from St. Luke's. It was available in the market. And even DOH would really download through the map, through the Medicina.
but according to DOH, the reason why there was a
Delay,
gap
yeah.
because they were waiting for the is that the renewal of the certificate of
I
product
believe
registration?
it's the renewal, yes.
Okay. Now, that is where the gap happens. Regulation is a very important component to access. That's why kailangan talaga na yung yung FDA should be very sensitive in situations like this. Kasi alam naman nila ng FDA na kailangan ito, and there's only one importer or provider of this product, and the possible recourse could have been that ipinayagan na lang ng importation under a compassionate license scheme instead of waiting for the product registration, because if the product registration is not done through an automatic renewal, then the waiting time is long. So, in the meantime, patients are dying. So, sana po, Deputy Director General, you could revisit your policy on renewal.
We look into this, Your Honor. Yeah, thank you.
Okay. So, Mr. Chairman, I would like to respond to the statement made by Director Ted Padilla earlier
Yes,
on
go ahead,
behalf.
please,
I would like to believe that your organization is not entirely supportive of our price regulation program. You said that regulation may not be the answer to bringing down price of medicines, because after all, the poor remains poor and they cannot buy anyway. So if that is the mindset of people from the industry, na porque pobre na sila, hayaan na lang natin that we just go for free market. After all, the poor cannot afford whatever price given by the private sector. That is why Mr. Padilla, na kami po dito sa Kongreso, Senado and Lower House are fighting for this program, and in fact no less than the President himself had directed Congress to pass this drug price regulatory amendatory bill to be part of 9502, considering na noon pa man kasama kami ni Congresswoman Hontiveros in the House, while si Senator Zubiri was already in the Senate. This is part of the original version, no? For whatever reason, when it was passed in 2008, inawala po. So, ang amin lang dito is we are not fighting any pharmaceutical company. In fact, the spirit of price regulation is towards regulating compounds or molecules. We are not targeting a particular pharmaceutical company. We're not targeting a particular product. We're targeting the compound itself, so that both innovator and the generic counterparts will be under the same regulatory scheme. So there's really nothing personal against anybody here. Noon pa man, tinatanong namin ang mga members po ninyo. Alam niyo po, Mr. Padilla, natapos lang ang hearing ng Kongreso in the 13th and 14th Congresses po. We have been inviting your members to appear and justify to us, members of the House, why Norvasc in the Philippines, before your discounts happen, would cost 80 pesos for 10 milligram and only 8 pesos po in India, and 40 pesos for 5 milligram and 5 pesos po in India, from the same provider, from the same manufacturer, Pfizer. Natapos lang po ang hearings, na ipasa namin itong batas na to. We have never seen people from Pfizer or any of your members under PHAP na nag-attend sa hearings namin ni Congresswoman, then Congresswoman Hontiveros, to explain to the members of the House, bakit hindi tayo mag-price regulation? Nobody appeared. Nobody provided the courtesy to the House to explain to us why such a huge, discrepancy between your pricing in India or even your pricing in Thailand relative to the pricing in the Philippines. And this is the reason why dito ngayon we are bent on passing this law, on creating the Drug Price Regulatory Board, because since the enactment of 9502 hanggang ngayon po, walang pagbabago sa presyo ng halos lahat ng mga innovator products despite this implementation of 9502. Well, it's good to hear from Secretary Obial the admission that all her predecessors failed to implement the law. Kasi kung in-implement lang po ito, yung batas na pinasa namin ni Senator Hontiveros, sana po wala tayo dito ngayon, di ba? If the Secretary of Health, all the Secretaries of Health before her, had actually recommended a good number of medicines to the President, and if the President had in turn responded by regulating prices, sana po wala na tayo dito. But we all know that the free market mechanism didn't work at all, and it will never work unless mag-create tayo ng Drug Price Regulatory Board. So yun lang po ang aking gustong iparating po sa inyo, Mr. Padilla, that we're not trying to single out your members. Ang sinasabi lang po namin is, since the time na pinasa itong batas na to, hanggang ngayon, most of the members of the PHAP have not favorably responded. In fact, what they did was voluntary reduction of prices of medicines, which is actually not legally binding. Kasi yung mga produkto naman na voluntary reduction ninyo, hindi naman yun po ang mga gamot na talagang kailangan ng taong bayan. And for those that were under the mandatory price regulation, there are only a few of them, less than 5 of these products, and it didn't make any dent at all. So, if we go through price regulation, yung mga pobreng tao natin, yung mga Pilipino na hindi talaga maka-afford ng ng mga mahihirap, will be subsidized by government. And when we have a reduced prices of medicines, naturally the budget of government will be stretched. So doon po papasok yung role ng gobyerno sa price regulation, that when medicines are now sold at a cheaper price, we have enough money to provide for our poor people.
If I may, Mr. Chairman, thank you for your observations. And for that little bit of history with respect to the bill. The industry, and we want to reiterate, the industry is definitely a partner. We consider ourselves a partner to provide health to all Filipinos, working with the Department of Health, with the LGUs, with various stakeholder groups and patient organizations. What we believe in is actually, I think you hit it pretty much by saying getting the government to subsidize. What we're actually looking at is encouraging the pooled procurement, using government as the single purchaser. And that way, even the member companies, whether the innovator companies or the generic manufacturers, can actually participate. So when you have pooled procurement and even multi-year obligations in place, then we can even discuss pricing. I mean, that's already at the purview of the individual companies. PHAP represents the industry, but we don't speak on behalf of each company when it comes to their own pricing. That's already up to them. What we do believe in is leveling the playing field for everyone. So if, and it's also heartening to see Secretary Ubial mention in one of her slides the World Health Organization's comment, what is a fair price? Which is a fair price is one that is affordable for health systems and patients, number one. And number two, at the same time provides sufficient market incentive for industry to invest in innovation and the production of medicines. We are one with that. There's no doubt. We also want to mention, because I know that the Philippines, we know that the Philippines is always compared with India, which is like a benchmark. The World Health Organization also recommends that when we select comparator countries, they should be based not only on the economic status, but also the pharmaceutical pricing systems in place, published actual versus negotiation or contracted prices, the exact comparator products that need to be supplied, and the similar burdens of diseases. Now, India's 1.3 billion population is quite significant compared to our 100 million plus. So that's also where you have a lot of economies of scale, so to speak. No? But we are not obstacles, because we actually support the government's initiatives on the pharma zone, in introducing, there is I think an EO on introducing generic drug manufacturing, so long as of course this comply with the good manufacturing practices that we talk about. If the FDA can get its PICS certification, even better. So you have our support in that respect. What we don't see, and I have to be very candid here, is that we think that a drug price regulatory board is not the solution. We think that what is the solution is just to continuously have a dialogue with industry and have a single procurer. The strength of government alone can actually help drive this without having to resort to a board. A board may actually be seen as another. There may even be a discussion on the regulatory impact assessment of another government body in place. Thank you.
Mr. Padilla, I think, yes, Mr.
Yes,
Chairman.
my co-chair, I'll have to excuse myself, a very important lunch meeting, but I'll ably represented by the former chairman of Committee on Health. Thank you very much, gentlemen.
Thank you, Mr. Chairman. We understand, Mr. Padilla, that there is clearly a difference between the market of India and the market of the Philippines. I mean, you're talking of scale in India. What we're trying to establish here is we should make medicines available at the most reasonable cost without jeopardizing the stakeholders, particularly the providers. Ang gusto lang namin malaman is what is the most ideal and acceptable price for the Philippine setting. Kasi sa ngayon, the reality is it's beyond the reach of the ordinary Filipino. I mean, you hear it clearly. It's good that we have patients like Ms. Garces and Derek here today. It's a clear graphic manifestation that ordinary people like them talagang walang kakayahan. And I think most of our audience here today will agree. pag magkaroon kayo ng cancer ngayon, you just have to, surrender. Wala na, it's only a matter of time, it's, you're gone. So, yun lang po ang aming layunin dito. It is not the intention of Congress to kill the industry. It is not even our intention to regulate all medicines. We're only looking at certain therapeutic categories where regulation should be applicable. Yun lang po ang posisyon namin dito. So I hope that it's clear that we're not here to kill the industry. We're very supportive of the industry. We know the cost of research and development. However, you have been entitled to a intellectual property protection for at least 20 years, enough for you to recover your research cost. So, pagkakataon naman that when the molecule becomes a public property, the Filipinos, the poor people especially, should be able to avail of that regime where the molecule becomes a public property. So, ganun po ang layunin ng Congress. I hope that, you can echo this to the members of the PIHA, that it is never our intention or motive to jeopardize, the economic survival of the pharmaceutical industry.
Thank you very much, Mr. Chairman. That message will definitely reach our members. Thank you.
Yes, Attorney Di Magiba.
May we inquire what's the timeline of Congress and Senate in the bill itself, creating a drug price regulatory board?
Well, the Senate Chair, Senator Zubiri, has yet to file the counterpart bill. In the House, it was filed, and hopefully before the year ends, we'll be able to pass this on third reading. So, hinahabol po namin. So, the Senate counterpart will be filed by Senator Zubiri, and of course, I'm sure that Senator Hontiveros will be a co-author of that bill. So, dito na lang po ang dapat gawin sa Senate.
One more, Mr.
Chairman,
Chairman.
if I could just also respond to your question, Attorney Di Magiba, because DOH actually asked us to file this bill even before they finalized the draft. So, aware na po yung Senate Committee on Health, now chaired by Senator JV, about the bill. So, as soon as matapos na namin yung drafting, we'll start the process of consultation with the stakeholders, putting it through the committee and plenary process. And Chair, before Attorney Di Magiba continues, I'd just like to add my observations about, I think, the very important part of the discussion that went on just a few minutes ago. Siyempre, dito Oversight Committee tayo on one law, yung quality affordable medicines. Pero alam naman nating lahat around the table, lahat tayong stakeholders, private sector, governments, executive, legislative, and civil society, na we're really talking about this law as part of a policy framework. So many of us, we share that dream about yung WHO model, universal healthcare system, 6 pillars, and Executive Director Padilla mentioned one of the pillars earlier. So sa ibang mga batas, magkakaalyado yung iba sa atin, like with PCPI sa generics law. In other bills, yung iba naman sa atin ang magkakaalyado, and other stakeholders around the table would have opposing views. And particularly on this drug price regulation, mabuti mauuna na yung DOH kahit sa atin sa Kongreso in expanding the maximum drug retail price list para with that in mind, yung karanasan ng mga mamamayan natin, yung mga pasyente natin with that list, Congress can look at how we can complement that to achieve the goals of quality affordable medicines. Minsan lang sa ibang mga bills, magkaiba yung pananaw natin, how much government do we need or how little government do we need. Pero sanay naman tayo sa process na yan. And ako, Mr. Chair, I'm confident na will engage in a quality process as if we have done in previous legislative processes to come up with the best bill possible. And then we test that one. The oversight committees will always be there naman to monitor whether they are achieving the objectives or not, and with kumbaga, with fairness to all stakeholders concerned, especially the patients.
Thank you, Mr. Chairman. Just to amplify our recommendation to bring back to the bill the two provisions on legal price manipulation and penalties, maybe we should also get the Competition Commission involved in the public hearing, and maybe in relation to PHAP's position on how they see these things should be handled. Maybe we can learn from them what is their program. Because when the Competition Act was deliberated, almost all of industry supported it. In fact, they were active members of technical working group as against the the complaint of Congressman Biron that PHAP was never seen in the deliberation of the cheaper medicine law. So we should probably learn from them. Meron ba silang plano to address issue of prices in relation to free market? There must be a reason why Congress repealed Section 24 and 25 of the Republic Act 95 Series 2. May dahilan po yun eh. In fact, ako rin nagulat eh dun sa during the bicameral committee, they specifically remove a lot of industry. They remove shipping. Basta, ang iniwan lang nila, they removed the Price Act. They also wanted to repeal the Price Act on price manipulation. No, we just leave the cheaper medicine law. So there must be a reason for that. And it should be very relevant as we now hear your bill on the creation of a drug price regulatory board. Yun lang po, para hindi natin makalimutan. Thank you.
Thank you, Attorney Dibagiba. Well, one of the last questions will be given to Ms. Miriam Tasara of the DOF. In the last hearing, there was a concern raised by the senior citizens organization from Quezon City. I remember it was Mr. Banal. And the reason why it was raised, because sabi po nila, ang hirap na bumili ng gamot sa mga maliliit na mga drugstore because hindi po ino-honor yung senior citizen. Okay, na 20%. And on top of that is a 12% exemption sa VAT. So effectively, you're looking at around 30% kasi less 20, less 12. So just imagine, Ma'am Tasara, that yung maliliit na mga drugstore who do not avail of the volume discount as being availed by the bigger chain of drugstores, kukunin po sa kanila yon. And we all know that their margins are very slim. Ang problema is hindi po alam ng mga drugstores on who will exactly bear the burden. Kasi it comes out na pagbilhin sa kanila, yung mga pasyente ni Ma'am Girlie, hingiin po yung 20% ng senior citizen and the VAT exemption of 12%. At the end of the day, walang tax credit po na ikiklaim ang drugstore. So, in light of all these tax reform programs that we are discussing in the House and in the Senate, this is one of the discussions that will be made on the floor of Congress tomorrow as we start deliberation on our tax reforms. So ito po, ako po, tatayo din doon sa plenaryo, purposely for this, for these patients, no? Sa mga availment ng PWD, kasi kanina narinig natin si Ms. Garces, hindi po ino-honor ng Mercury yung ID ng PWD. So, hindi natin alam kung bakit. Perhaps we can ask Attorney Makaspak later to respond. Pero gusto ko lang po malaman, dito sa ngayon, on the part of DOF and the BIR, ano po ang pwede nating gawin so that the discounts, or the discounts being availed of by the patients, senior citizen, and the PWD, pwede po makiklaim ng ating mga merchants, ng ating mga drugstore owners?
Thank you. Thank you, Mr. Chair. As regard to the discount, the existing law for both senior citizens and PWD, these are deductible from the gross income of the drugstores. So there are revenue regulations already issued that the drugstores can claim as an allowable deduction from the gross income. So it reduces their net taxable income on the discounts. But as to the exemption on VAT, since these are exemption, so they cannot credit it against their output tax.
Right, that's right.
That's the
So may
difference.
input sila, wala silang output.
There's there's an input tax on the purchase of the medicine,
But there's
but
output
upon sale
VAT,
there's
yeah,
no
upon
output
sale.
because these are exempt. So input is more than output. So they have to pay. The drugstores, they have to pay. That's the difference on the exemption and if they are imposed with the VAT. So that's the difference on the VAT. But as to the discount, these are deductible expense.
As expense.
As an expense
All
from
right.
the gross income. So it reduces their net taxable income on their income tax.
But not for the VAT.
For the VAT, since this
Have to pay.
since this is a different type of tax, so the drugstore should, since nga their sale is an exempt sale on sale of drugs to senior citizen and PWD, so their input tax upon purchase of the medicine is more than their output tax because the sale is exempt.
So the VAT differential, babayaran po nila kasi mas sobra yung
Yes.
input nila kaysa output nila. And the reason why I'm also raising this because hospital owners have also approached me. And it's the same thing also in the practice ng hospital kasi hindi rin sila nagva-VAT, di ba, sa hospital. Yung input binabayaran nila but VAT-free naman yung mga gamot sa pharmacy. Is that correct?
Services, sir, on the services.
On the services,
Yes.
but not on the commodities. So sa services nila, VAT-free sila.
Yes, sir.
So what is the initiative on the part of DOF to correct this? Kasi mas lalo nating biniburden ang mga maliliit na mga drugstore. Of course, even Mercury is affected. So what are the initiatives, in pursuit of all these discussions on tax reforms? Kasi mapapasa na yan before the end of the year. Mapapasa yan. After the SONA, mapapasa na itong bagong ang tax reform laws na pinupursu ng Kongreso.
Sir, the existing senior citizens law and the PWD is status quo. It's not part of the tax reform. So they're still enjoying the privileges provided in the law.
But at the expense of the small merchants, the small drugstores. And precisely why pumipila ang lahat ng mga PWD at saka senior citizen sa Mercury. Kasi hindi inaasikaso ng mga maliliit na mga drugstore kasi wala naman silang mapagkuhanan ng VAT na 12%. Kasi ang margin lang nila is probably less than 10%. Tapos i-exempt pa sila sa VAT. So they will have to pay for the net input VAT. Kasi wala silang mapagkuhanan ng output eh.
As regard to the small drugstores, if they are qualified to be VAT registered, so their sale is exempt. But if they are not qualified to be a VAT registered, they're subject to percentage tax. So it's different from the value-added tax. So the small drugstores, if they are not qualified to the threshold for being a VAT registered, so they're subject to percentage tax. So this is being part of the cost to so the VAT exemption is not applicable to them. If they're not VAT registered.
Most of these drugstores naman, ma'am, are VAT registered eh. Kasi in excess of, what is the ceiling for a gross income
Right
to
now,
be VAT?
I think more or less 3 million.
And most of these are VAT registered because at least they earn 10,000 to 15,000 in a day. That's 450,000
So they
a
are
month.
all VAT registered?
Yes, they're all VAT registered. I'm sure they're all VAT registered. So, yung exemption will really hit them because they have to pay for the input VAT because wala silang mapagkuhanan ng output VAT.
Sir, only on the sale to senior citizens or PWD are exempt. So, but all their sales are subject to output tax.
Ma'am,
So,
the study shows that in a regular setting, retail, at least 20% of the customers would come from senior citizens and PWD. So malaking porsyento 'yon sa gross sales ng mga maliliit na drugstore ang senior citizen. So more often than not, nire-refuse na lang nila yung senior citizen kasi hindi rin nila kayang magbigay ng VAT exemption of 12%. And most of these drugstores hindi nila alam na yung discount is actually deductible from their income tax. So, yun ang mga misconception doon sa sa mga maliliit na mga drugstore. They operate standalone, isang drugstore. So, instead of catering to this PWD and senior citizen, sinasabi na lang nila po, sige, punta na lang kayo sa Mercury, punta na lang kayo sa Watsons kasi doon may senior citizen lane sila. Tapos ito naman yung mga malalaking drugstore, I will confirm it later from the Attorney Makaspak, they're trying to undertake reimbursements from their wholesale suppliers, yung senior citizens discount nila at saka yung VAT. Which shouldn't be the case kasi it should be declared as an expense, yes, deductible from income tax.
as regard to PWD law, the recently issued the IRR, I think the SWD, who is the implementing agency of that law, has a penalty clause, I think, a provision that those business enterprises that are supposed to impose or to sell with discount, those who are not following the privileges granted in the law should be penalized. So I think the implementing agency of in the case of the PWD should inform the business enterprises, particularly on the small ones, that that these privileges can be also their privilege by the discount by deducting the discounts granted to PWD and senior citizens as a deductible expense from their gross income. So I think more on information dissemination on the part of the implementing agency of these two laws. Because as regard to the revenue regulation, this has been issued already, and the business enterprises are entitled to the allowable deduction.
Kasi sa tax reform agenda ngayon ng gobyerno natin, in-exempt ito eh. Hindi ginalaw ito yung yung senior citizen at saka PWD eh. But in reality, it affects the small guys, especially on the VAT exemption. Sana ang maging initiative ng DOF is also to exempt purchases, exempt the VAT payment of those purchases made available for the senior citizens and PWD. Sana hindi napabayarin yung merchant. Kasi kawawa sila eh. You know, if 20% of the gross sales or the revenue would come from senior citizen and PWD, necessarily it affects the
the exemption, if I may, the principle of value-added tax, the exemption on the sale of medicines and other commodities to a particular sector is already a distortive, it distorts the system of the value-added taxation, because the same product the sale to one sector is exempt, but the sale of the same product to another sector who is a regular taxpayer is not exempt. So it's a distortion on the system. It is already a distortion on the system. So it's very difficult to implement, particularly by the tax administrator. So if we are going to exempt on the purchase side, again, another distortion. It's very difficult to monitor.
We really understand, Ma'am Tasara, the complexity of this whole thing. But what we're just trying is because in light of the discussion for cheaper medicines, naapektuhan po yung commodity. Yes, and it affects also the economic viability of these small players, which are the small drugstores. Yun po ang the reason why we just raised this, because the Congress is now very busy discussing tax reform laws and all these things. So tayo po we're also discussing the efforts of Congress on how to bring down medicines and how to ensure continued viability of all our stakeholders. That's the reason why we raised this. Yes. Go ahead.
So if I may, as regard, if I may manifest on the other matter, with regards to the Pharma zone, although it's not yet presented, as mentioned by the Honorable Chairman Subiri, that they are still awaiting the presentation of the DTI-BUI on the proposed Pharma zone. We would just like, so in the absence of the structure of the proposal, we would just like to manifest on the tax implication. We understand that existing economic zones have a preferential tax regime. So, special economic zones are created especially for export activities. So, hearing from the discussion that the issue on hand is the prices of drugs or medicines, or the quality affordable medicines, we would like to be clarified how the proposal to create Pharma zone will address the issue on hand. Thank you.
Actually, the initiative is really it came from the DTI, and it's not the initiative of Congress. The DTI and DOH, yes. So I think you were not here during the first hearing, Ma'am Tasara. So it's really the initiative of DTI along with DOH in creating these Pharma zones. Yes, you're correct that economic zones are really geared, the creation of which are really geared towards exports. That's why sabi ko nga, creating Pharma zone is a brilliant idea, if only to make the bulk of our medicines locally manufactured. But providing incentives for these investors to come is one thing. Making it a reality is another thing, because we have to understand regulation. Sabi ko na nga kanina, the normal gestation of establishing a factory until the first product comes into the market is 6 years. Now, we will ask the potential investor, are you willing to wait that long, for your first product to come out into the market, 6 years after the establishment of your factory. So I think this particular discussion on Pharma zone needs a little more in-depth study as to its viability. But the idea is a brilliant idea. But as to how it becomes a reality and responding to the need for making products available at a cheaper price compared to imports, that's another thing that we have to understand. Yes, Attorney Escalona.
Yeah, Mr. Chair, with the permission of the chairman, if I just may quickly share a solution that we are hearing, a proposed solution that we are hearing from our members with respect to the VAT issue and its impact to the access raised by the chair. What we're hearing, but to be frank, I'm not clear yet as to why this will be a solution, is that what we're hearing from our members is I think there will be a big difference if instead of VAT exempt, that it be zero rated. I'm not sure. They're saying something that if it's zero rated, they'll be able to claim credit for it, so that then it will not have an impact, an adverse impact to them as against exempting the VAT. So I'm not sure. Again, to be frank, I'm not sure if there's any, but that's the solution we're hearing from our members.
I don't know. When you say zero rated, you're talking of tariff, right? It's not VAT, meaning your duties. It's still VAT. Okay. Can you respond, Ma'am Tasara?
As regard to the difference between the tax exempt sale and the zero rated sale, so your sale on, or your zero rated sale, you still I'm sorry, the difference between the exempt sale and the zero rated sale is that the zero rated sale is you still impose, provided it's 0, not 12. So you still have an output 0. You have an output 0. So you, for recording purposes, so your output tax is you have 0 rated sales plus your 12% VAT sales. And yours, you can credit, it's creditable against your input tax. Whereas your exempt sale is, since exempt siya, so it's not creditable. So that's the difference between exempt sale and zero rated sale. Creditable, the zero rated is creditable from your input tax.
So what is there to credit in your output sale, considering that is 0?
0.
Yes.
Yes, sir. Pero still,
Pwede mo pala ma-claim siya. I mean, output versus input. And the net VAT differential is the VAT payable.
And the main difference, sir, is that the senior citizen, the sale to the senior citizen is, I'm sorry, I'm a little bit confused. Zero rated sale. So the cost, so your selling price is, the selling price is how much is being paid by the senior citizen, for example. If it's zero rated, so the selling price, for example, is 100. The selling price is 100. And the VAT is 0. So your sales is 100. Then output tax is 0. So there's no output tax, 0. And the cost received by the drug stores is 100 also. So you have output tax 0, and then selling price the same amount. But if it's an exempt transaction, so since it's not transparent, exempt transaction, so the cost of the selling price may be more than the actual selling price, because it's an exempt transaction. So you do not know if there is an output tax there in the selling price, because it's an exempt. Whereas, cascading effect of the input-output tax kasi, sir, So, pag 0% siya, naka-reflect yun dun sa invoice natin ng 0 rated sales. Pero pag exempt po, hindi yun naka-record. So, yung for recording, medyo maano yung explanation ko. So, for recording purposes, hindi po transparent pag exempt eh. Kasi meron tayong tinatawag na input-output mechanism on the value-added tax. Medyo
Yes.
ano lang yung...
I think, ma'am, from the practical perspective, we can ask Ma'am Attorney Makaspak on the practices. Kasi sa pagkakaalam ko po, yung mga senior citizens at PWD, when they purchase, they really demand for the 20% discount and the 12% exempt as calculated in the receipt. Hindi sila aalis ng drugstore hanggang hindi nila makita yung resibo na yan na 20% discount reflected doon at 12% VAT exempt. Am I correct? Yes. So, Attorney Makaspak, can you please enlighten us as we wind up this discussion?
Your Honor, I want to apologize because I'm not privy to the financial aspect of.
Mr. Chairman, in that case, perhaps we could just request the good attorney to request Mercury to make a submission to the committee. Maybe your thoughts on the idea from PCPI members and based on the explanation of DOF, how exactly is the practice in Mercury vis-a-vis your customers?
Okay, Your Honor.
And Attorney, can you please include, when you report back to your office, the concern raised by Ma'am Garces? Bakit po hindi nyo in-acknowledge yung PWD ID nyo po? Ano bang dahilan? Bakit? No, kasi syempre, tuloy-tuloy po ito unless Deputy Director General Santiago will facilitate the issuance of a special license for compassionate drugs na mapag-import siya po ng mura, tuloy-tuloy pong pagbili niya ng ondansetron po sa sa Mercury. So sana po ma-address niya naman ang problema niya sa ID. Ma'am Gurley.
In answer to your question po regarding why Ma'am Realin was not given an exemption, it's because we had a dialogue, Papo had a dialogue with NCDA, who issues the PWD, the policies, and they said that if the patient does not manifest anything that shows disability, then they are not qualified. That is why, sir. That's why I want.
Yes, ma'am.
That's why po I want
Yes.
sana on behalf of the patients, especially those with chronic illness, to set forth, if it's possible, that we have a 20% for the patient sector. Because if they don't qualify in the PWD sector, we cannot avail of the 20%.
Well, you know, yun ang problema dito because you have to appear physically disabled. You have all the, dapat nagka-crutches ka, ganon. This is a systemic disability, a life-threatening condition that warrants recognition by government. Yes, yes, Ma'am Tasara.
If I may, sir, Mr. Chair, as regard to or related to the tax exemption or the tax privileges provided under the PWD, the recently issued revenue regulation, the BIR provision in their issuance is also dependent on the issuance of the DOH on the listing of the persons with disability illness. So I don't know if there are issues being encountered by the PWDs right now and on the availment of the exemption or the privileges under the PWD law, because I understand there's no list yet issued by the DOH.
Yes, Ma'am Gurley.
There is a list. Actually, there are 7 categories only. And for a chronic illness person who does not manifest or does not fall under that list, they cannot avail of the 20%. That's why we are manifesting, if it's possible, maybe we can have something for the patient sector, the chronic illness.
I think we'll just have to, I was sharing with Senator Hontiveros, probably our initiative to talk to the implementing agencies and probably revisit the IRR. Kasi, syempre kung titingnan mo si Ma'am Garces, wala siyang sakit, no? She's pretty, she has, so the drugstore will never know that she has cancer.
And sir, sometimes with chronic illness, at the time that you apply, it does not flare up. But after you've applied, let's say there's heat and all that, especially for scleroderma, psoriasis, it flares up, then that's the only time that it's manifested. So again, maybe we could have something for the patient sector. Thank you.
Yes, especially for
Chairman.
immune deficiency diseases. Yes. All right. So yes, Senator Hontiveros.
Thank you, Chair. And I suppose that pagpunta po sa botika, may dalang PWD ID, di po ba? So, hindi lahat. Okay, so yun, gap na kailangan nating tugunan. Pero for those carrying IDs, dapat, Chair, may presumption of regularity yung private sector, botika, na pag may PWD ID, kahit sabi nga ni Ms. Realin, ano bang gagawin? Kung breast cancer ang sakit, kailangan magpakita. Siyempre, hindi naman doable yon. Ikaw pa yung kakasuhan ng kung ano, di ba? So, dapat, the PWD ID is proof na you are entitled to such an exemption.
All right. Yeah, Ma'am Tasara.
Yes, Mr. Chair.
Yeah.
If I may, in relation to my explanation a while ago on the suggestion on the zero rated, if I may add, for the zero rated sales, the VAT registered firm or taxpayer may claim for a tax credit on the excess of input tax over output tax. So that's the difference on the tax exempt, the VAT exempt transactions versus zero rated transactions.
Also, so for zero rated, yung sobra po doon sa income nyo will be a credit, VAT credit, which you can apply in future VAT payments.
Under the tax code, sir.
All
So that's
right.
the difference. So creditable, we call it creditable input tax.
All
So
right.
if your output tax is less than your input tax.
Yeah. All right. So continuing credit ito, you can always apply in your future
Yes, sir.
VAT payables. All right. Okay. So the chair would like to know if there are other resource speakers who want to. Yes, Mr. Cruz.
Sir, good afternoon. Just to inform everyone that the BOI encourages the investments in manufacturing activity like the generic manufacturing, local generics that can sell to the domestic market, and they can avail of the incentives given to the government if they qualify.
And what are these incentives, Mr. Cruz? Are these ITH or?
ITH, income tax holiday, zero duty for imported material, imported capital equipment, tax credit on exported products.
But not VAT exempt.
Not that exempt.
And how many years is the ITH?
ITH is, it depends. If it's a pioneering activity, it's 6 years. If it's non-pioneering activity, it's 4 years.
Well, obviously, this should never be considered as pioneering because we're talking of pharma, unless perhaps that the
API.
facility is a pioneer facility like a biological unit or a vaccine factory. Then it's a totally different category. Is that correct?
Yes, yes, sir. And even if they would like to expand their activity or putting up additional project cost, they can register it under expansion, which will give them 3 years of income tax holiday.
Thank you, Mr. Cruz.
Welcome.
Is there any other comment from any of our resource speakers? So, yes, Senator Hontiveros.
Thank you, Chair. Bago natin isara yung hearing ngayong araw, napaisip ako sa tanong ni Attorney Di Magiba kanina kung bakit kaya nawala sa Quality Affordable Meds Law yung drug price regulation. At ngayon ay kinakailangang marinig sa DOH yung request nila to pass such a companion measure, and mukhang at least around this table nakakahanap ng suporta sa members of Congress, 2 houses at saka yung mga pasyente. Siguro naisip ng karamihan ng mga BICAM committee natin noon, siguro akala nila that the free market, that less government would make medicines, quality medicines, more accessible or free for patients. Apparently, batay sa review natin so far, hindi ganon yung nag-materialize na scenario. Hence, yung request ng DOH and then the favorable response from at about 2/3 of the stakeholders around the table. So, tignan na lang po natin if we can take that step together para i-improve yung kabuang policy framework for health dito sa ating bansa. including all the inputs from the one-third stakeholders around the table. At hanap na lang tayo ng iba pang mga bills na mapagkakasunduan kasi napakarami naman ang ating tinatrabaho. So thank you, Mr. Chair.
Thank you, Senator Ontiveros. The chair would like to thank Senator Riza for her valuable contribution today. Sa ating chairman, Senator Zubiri, Congresswoman Tan, and to all our resource persons who attended in today's hearing. We value all your comments, your contributions, and I hope it is the desire of the chair na sana matuloy na po itong pagpapasa ng amendments sa Republic Act 9502. Once again, thank you so much to everyone. Magandang hapon po sa inyong lahat. Sorry. On the part of the House, this meeting is adjourned.
And on the part of
Sorry.
the Senate, in behalf of Chairman Zubiri, yes, this meeting is adjourned. Maraming salamat.
Thank you.